February 12th, 2021, suspending Hawaii Revised Statutes, Chapter 92, Public Agency Meetings and Records to the extent necessary to enable boards as defined in Section 92-2 to conduct meetings without any board members or members of the public physically present in the same location, among other things. The Board of Education will be holding virtual meetings until further notice. The public can still call in or log on to listen to board meetings live. The live broadcast is audio only for both board members and the public. Video of board members and any presenters will not be broadcast. An image of the agenda will be shared on the screen to reduce the amount of bandwidth that this meeting takes up and to preserve the quality of the audio. Board members, be sure to raise your hands in WebEx to participate in the discussion and wait to be called on before speaking, and be sure to mute yourself when you are not speaking. State your title and name when you participate so members of the public know which board member is speaking, and put your hands down when you are finished. If you lose connection, please contact board staff immediately. In addition, before we call the meeting to order, I wanted to acknowledge our military representative, Captain Lynn Yatko. This is her last meeting. She will be moving on to a different assignment, and I just wanted to say that your attendance and active participation representing the military families has been greatly appreciated by all board members. We wish we were in person so we could give you a lei in addition to our aloha, but I do want to thank you for being here with us very faithfully throughout the times we met in person and now the times we are meeting virtually. So thank you very much, Captain Lynn Yatko. With that, I'm calling the meeting to order at 2:02 p.m. The first order of business is the approval of our December 17th, 2020 special meeting, executive session, our minutes, and our December 17th general business meeting. Also, there was an executive session there on our January 14th special meeting and January 21 general business meeting minutes. It's quite a collection of minutes. We had several meetings in a very short amount of time. Before we start discussing this agenda item, I'd like to note that we have changed our approach to receiving oral testimony, and before each agenda item, we will take any public testimony related to that agenda item. As usual, members of the public who signed up to testify must be logged into WebEx using the same name that they used to sign up for testimony. The board staff will call on testifiers in the order in which they signed up. Before each agenda item, board staff will unmute the testifier's mic. Please be sure you check and ensure that your microphones are working. And information to do this is available on the board website. If you are not able to resolve technical difficulties that may come up, then you will be muted and you will have an opportunity to testify at the end of the meeting. You may only testify on one agenda item at a time. Testifiers will have 3 minutes as their limit. Please state your name and your organization if applicable. So we will begin. If there are any testifiers on this agenda item, board staff, please let me know.
Board Chair Payne, I have no oral testimony for this agenda item.
Okay, thank you very much. So we are going to, I need a motion on the minutes. So if somebody would do that, I would appreciate it so we can move on forward. Board Member Fallon.
So moved.
Thank you. May I have a second? Board Vice Chair Uemura.
I second the motion.
Okay, it's been moved by Board Member Fallon and seconded by Board Vice Chair Uemura to approve all of the minutes. Is there any discussion on any of the minutes that we are approving? Seeing none, I will say that the minutes have been approved. We're now at agenda item number 3, which is the reports from the Board of Education Human Resources Committee. Are there any testifiers on this committee report?
Yes, Chair Payne.
Okay, so please begin.
Julie Reyes Ora, followed by Susan Piccola Davis. Julie Reyes Ora, Nana Kuli High and Intermediate. Julie, can you hear me? Julie Reyes Ora. Board Chair Julie Reyes Ora is not connected. Susan Piccola Davis. Susan, can you hear me?
Yes, this is Susan Piccola Davis.
Please proceed.
Thank you. I wanted to bring up the earlier meeting because I noticed that the agenda item regarding reduction in force seemed to be rushed. And there was a very important thing that Board Member Cox brought up at the very end that I don't think people were paying attention to. But what she asked were, how many of the 61 that are on the list are special ed EAs? And she didn't really get an answer, but the answer that she had got was most of them are in special ed. Anybody that's been in a special ed class, I don't know why they would want to get rid of their education assistant. It just bogs my mind. And because of the time constraints of the meeting, it just seemed like it was rushed. I kind of thought if there had been no funding reductions, then all 61 of these would have still had a job. And positions were given up to use return money for other school funding needs. I know it was talked about whether it was because the positions weren't needed anymore. I hesitate to say this, but I do want to say it. When they got the money, the funding back, I would suggest that you consider that they used the funding for other things that they were lacking in their budgets. Thank you very much.
Chair Payne, no further testimony on this agenda item.
Mahalo. We will now move on to the report, and I would like to have Chairperson Dwight Takeno provide the committee report on the meeting that was held earlier today.
Thank you, Chair Payne. Board Member Dwight Takeno here. The HR committee met today at 11 a.m. with all committee members present. On the agenda, we had 4 action items in which I will present a report on behalf of the committee. The first action item was the committee action on the recommendation concerning the appointment of complex area superintendent for the Hana, Lahainaluna, Lanai, Molokai complex area. Superintendent Kishimoto provided a presentation along with Deputy Superintendent Phyllis Unibasami. Also, the recommended candidate, Dr. Rebecca Winkie, was also present. Due to the limited amount of time and the number of action items on the HR committee agenda, the committee recommended that we continue this discussion during the general board meeting. And thank you to Dr. Rebecca Winkie for, I guess, extending her time with us and being present in this afternoon's meeting. Number 2, the committee action on the recommendation concerning the declaration of annual reduction in force for classified employees. to initiate collectively bargained placement rights for employees displaced due to changes in staffing needs. After a discussion on this agenda item, the committee recommended that the BOE authorize the department to commence a reduction in force for classified employees whose positions will not be funded in the 2021-2022 school year due to lack of work, need, or funds. The recommendation passed with five ayes and 2 nays. Number 3, the committee action on the recommendation concerning compensation adjustments for DOE employees included in bargaining unit 13, coded as unit 35, since they are excluded in managerial employees. After a brief discussion, the committee recommended that the BOE approve the salary updates, compensation adjustments, and tentative agreements for these EMCP employees excluded from bargaining unit 13 and coded as BU 35. The recommendation passed with 7 ayes. Finally, the committee action on the recommendation concerning the new superintendent employment contract. Due to the amount of time the prior action items took, the committee moved to refer action on a new superintendent employment contract to a meeting of the full board to take place no later than March 18th, 2021, and provided that no less than 8 board members in attendance. So it was deferred so we could have enough time and attention to take up this important matter. And with that, it concludes the HR committee report. Thank you, Chair.
Thank you, HR Chair Takeno. We now move on to our only discussion item, the presentation on the Department of Education strategies for a safe reopening of elementary and secondary schools to more in-person learning for the fourth quarter of 2020-2021 school year. I will now ask board staff to call on any testifiers who have signed up to provide oral testimony on this agenda item.
Susan Piccola Davis, followed by Rebecca Hadley Schlosser, Sherry Nakamura, Justin Huey. Susan Piccola Davis, can you hear me?
Yes.
Please proceed.
Were we given a time limit?
3 minutes.
Thank you. I'm opposed to the safe reopening of elementary and secondary schools presentation because I want to go through the slides, but very quickly. Slide number 2, there still isn't a pie chart that indicates the number of students that are online distance learning by school choice, not by parent choice. The number 1 problem with the slides, they're all referencing quarter 2. It would have been appropriate for the public to see the same data using quarter 3 numbers. Slide 3, metrics 2 and 3, social distancing and ventilation. You cannot read the text and is not available on the downloadable Excel spreadsheet. There are no tabs for those 2 metrics. Slide 4, physical distancing to the greatest extent possible. How are you going to do that? Slide 5, with the absence of data regarding individual school case numbers and non-specific data regarding communities, how are you going to get stakeholder input? Slide 8, elementary schools do not have space in classrooms. Secondary schools will still be changing classrooms. There's more opportunity for interaction and lack of social distancing. Classrooms are not large enough. Slide 9, engagement. Parents and families are stakeholders. Collaboration with unions remains to be seen. I still haven't heard anything about except for at the Board of Education meeting, anything regarding parents or families' input. So I already mentioned distancing, but I want to bring up the assessments. ESPA that are coming up, and my gut feeling is that we're bringing back the kids because we want to test them. However, the U.S. Department of Education has given guidance that says we can extend the testing window and move assessments to be done in the summer or fall. We can give them remotely where feasible, and we can shorten the state assessment to make testing more feasible to implement and prioritize in-person learning time, which is probably more important than a test. They also are allowing the states to request a waiver for the Every Student Succeeds Act accountability and school identification requirements. To this date, I do not know if our state has applied for anything. The website does not show that Hawaii has submitted it. Much.
Rebecca Hadley Schlosser, Sherry Nakamura, Justin Huey, Lisa Morrison. Rebecca, can you hear me?
Yes, I can. Can you hear me?
Yes, please proceed.
Thank you. Good afternoon, Chairperson Payne and members of the Board of Education. I'm Rebecca Hadley Schlosser, a proud special education teacher at Nanikapono Elementary School and a proud member of the Hawaii State Teachers Association. I'm speaking on the strategies for safe reopening of elementary and secondary schools to more in-person learning for fourth quarter of this school year. I've reviewed the DOE metrics documents and am genuinely concerned by some of the numbers presented. To me, these numbers would indicate that we need to pause the discussion on whether to reopen elementary schools to full in-person instruction at this time. I found it interesting to note that the raw data provided by the DOE does not include data from our public charter schools. Hawaii has 294 public schools, including public charter schools. As of the end of February, the data provided by the department is not inclusive of all schools in Hawaii. The data appears to lack information from our public charter schools. This may skew the data that has been provided by the department in the metrics document that's available on their website. However, when reviewing the information, it is apparent that there are still schools who are not ready to open to full in-person learning because they lack sufficient PPE to get through the end of the school year. According to the department's data, 171 schools have less than a 60-day supply of PPE in one or more categories. If you want teachers in their classrooms teaching students in person, you need to ensure that they have proper and sufficient PPE before opening those schools. If you cannot ensure that there is proper and sufficient PPE, don't open the schools to full in-person learning. This is a recipe for disaster if you do. I have friends who are also special education teachers at other schools, and what I hear from them is that their school, despite what it says in the department's data, does not have sufficient PPE for the staff. These teachers are buying their own disinfecting wipes because they are not being provided by their administration. Another metric is classroom ventilation. According to the department's data, there are still 1,319 classrooms that are not properly ventilated. How can you ensure the safety and well-being of the teachers, educational assistants, students, and other staff who may be housed in these classrooms when their rooms aren't properly ventilated? I'm being told by numerous elementary schools that their principal has informed them they will be going back to full in-person instruction come March 22nd. From what they're saying, there was no input from teachers as to whether this was going to happen and how it was going to happen before they were told this. Fortunately, I'm not in this position. Our administration team at Nanikapono has been very open and has worked collaboratively with us to make decisions from the beginning of the school year. We've had numerous discussions about how we're going to bring students back and what it will look like. We also are given the opportunity to provide feedback on procedures so that we feel we are heard and valued by our administrative team. It concerns me that other teachers are not being treated this way. Their principals are being told by the DOE that they have to have students returning March 22nd, but they are not having those important discussions with their teachers to ensure a smooth transition back. I realize the goal is to have all elementary students return to campus daily, but if we remain 6-foot social distancing requirement, no elementary school is equipped to do so. There's only so much space in an elementary classroom that can be utilized for student desks to be placed 6 feet apart. I've had to reconfigure my room several times when I had more students coming in. I have room for one more student and I need students.
Sherry Nakamura, followed by Justin Huey, Lisa Morrison, Carly Kanehiro, Deborah Bond Upson. Sherry Nakamura, He'e Coalition, Hui for Excellence in Education, Executive Director. Sherry, can you hear me?
Yes, can you hear me?
Yes, please proceed.
Thank you. Aloha, Chair Payne and members of the board. I'm Sherry Nakamura, Director of He'e Coalition. We would like to comment on item 4A. You have our written testimony in which we believe that a smooth reopening of schools to in-person learning will be difficult for the system. We are particularly concerned about the lack of data collection and transparency of that data around the schools. It appears that the DOE is not keeping a detailed inventory of the educational delivery modes of the schools. We don't even know how many schools are still in full distance learning. Further, DOE has shown what percentage of schools are in hybrid learning, but it is not clear if DOE is keeping track of what kind of hybrid learning it is. For example, it appears that hybrid learning seems to consist of anywhere between 1 and 3 days of in-person learning. We think that the DOE should know the details of the learning modes of every school and be transparent about it. The goal is to get to full in-person learning for the system. But if the DOE does not know what the situation is of the system, then it is difficult to know what is needed to get to the goal and what kind of support the schools need. It is one thing for the superintendent to say, it's about kids and what they need. It's another thing to provide the proper guidance and support to schools and not leave them once again bearing the burden by themselves. Thank you for this opportunity to testify.
Justin Hui, followed by Lisa Morrison, Carly Kanehiro, Deborah Bond Upson, John Kaihue. Justin, can you hear me?
Yes, can you hear me?
Yes, please proceed.
Aloha, my name is Justin Huey. I teach third grade special education at King Kamehameha III Elementary. I'm testifying against discussion item A. The DOE sales pitch to reopen schools is like the mayor in Jaws saying the beaches are open and people are having a wonderful time. The Biden administration is repeatedly saying that now is not the time to loosen restrictions. He is trying to pass $130 billion in order to have enough resources to reopen safely. We don't have the funding yet. Why are we spending $60 million on for-profit testing during an economic crisis? I called OESE and they said that we have not applied for the waiver yet. There have been confusion with the health and safety guidelines. My principal took the word should to mean that teachers could choose not to wear their masks in their bubble. After a second complaint, I called the governor's office to see if the proclamation superseded the DOE. My admin now says it's mandatory. Numerous teachers at my work site have said that they have not been able to get their vaccine yet. Kids ages 5 to 12 are now the highest positivity prevalence age group in England. The variant that has closed schools there, as well as in Italy, is much more aggressive in children. The same variant is in Hawaii. I am very concerned about guilting teachers into coming back because it's what's best for students. Kids have suffered from organ failure, permanent neurological disorders, and death. None of those are what's best for kids. We need trust if we are to reopen. Senator Kandani made comments that the DOE was lying about COVID cases in our schools. I asked teachers yesterday to post on Facebook site how many schools on Maui have had a positive case this school year. 9 teachers from different schools have reported positive cases. Please direct the DOE to provide accurate weekly data on every school. Reopening schools without informing the public who have contracted COVID is like the county not posting warning signs after a shark attack. I don't feel safe at school and feel it is irresponsible to reopen now. I don't want to bring the virus home, which could kill my 1-year-old son. Please focus on reopening responsibly in the fall. Also, I feel we need a more independent entity enforcing health and safety guidelines. I do want to say mahalo to the members of the board for your actions this school year. I do feel you have truly supported Board of Education Policy 1110-6. The board is committed to supporting a safe and healthy work and learning environment that is conducive to student and employee well-being. Thank you very much.
Lisa Morrison, followed by Carly Kanehiro, Deborah Bond Upson, John Kaihue. Lisa Morrison. Lisa, can you hear me?
Yes, I can. Can you hear me?
Yes, please proceed.
Thank you. I'm a teacher at Maui Waina Intermediate School on the island of Maui, but today I'm giving testimony from the perspective I hold as the parent of a child in elementary school. I'm also speaking on behalf of my children's father, who would have liked to speak but is picking the kids up from school right now. I'm concerned that in the engagement slide of the department's presentation, it's slide 9, I believe, the plan for full face-to-face instruction in fourth quarter is one-way communication to parents about on-campus attendance, and that's it. No effort to explain how full classrooms will change the safety level of my child's education. And in December, I was asked to commit to sending my child in person 2 days a week versus 100% distance learning. And I did so based on the blended model and safety plan in place at that time. If those change, parents like myself should have the option to choose again what model they consider safe for their children. I'm very concerned about the impacts to my child if all students at his school are on campus every day. I understand that some parents are desperate to have their kids back on campus no matter the risk. But as a teacher, I'm witnessing firsthand how this plays out in an actual Hawaii public school. Some things I can't even say in a public forum because of the professional role that I have. I wish that all parents understood what logistical problems will need to be solved and how much time that takes in order to make another switch in school models. Realistically, school employees would need a couple of weeks to even plan the implementation. The state epidemiologist says the riskiest activity is mealtime when students wouldn't wear masks. In order to keep proper distancing and small groupings, there could be several lunch periods needed. Is it academically helpful to any child to have to eat as early as 9:30 a.m. or as late as 1:30 p.m.? This is a real possibility to assure smaller numbers of students are in the cafeteria at one time. And do parents realize that much of fourth quarter in public schools revolves around standardized testing for grades 3 through 8 and grade 11? I personally will be refusing to have my third grade son participate in the tests, as I am not sending him to school risking COVID exposure only to not have valuable learning time with his teachers. I don't need dubious test results to tell me how he's doing academically. I trust in his teacher as a professional, and I trust that my son is doing his very best during a global crisis. Please do everything you can to help parents act in the manner they feel is appropriate to keep their children safe. Mahalo.
Carly Kanehiro, followed by Deborah Bond Upson, John Kaihue. Carly Kanehiro, can you hear me?
Yes, can you hear me?
Yes, please proceed.
My name is Carly Kanehiro. I'm a teacher at James Campbell High School, and I'm commenting on the discussion item A on the reopening strategies. What has the DOE done to ensure that it is safe and equitable for all, not just some? Most, if not all, measures have come with public push to ensure safety within schools and not from the DOE, such as mask mandates, 6-foot social distancing, asking for metrics to be created in regards to transitioning between learning models, and asking for safety training, to name a few. Not all teachers have been vaccinated yet, and a lot of them were able to get vaccines because they didn't schedule it through the DOE. They made their own appointments on their own. So we're going to push teachers back into classrooms with potentially more students when not all of them have had the chance to get vaccinated yet. You can't really ask us to reopen when not all teachers have had the option to get the protection that they need. So are we saying that it's okay for some teachers to be able to feel safer and some teachers to not feel safer? Also, because there is a push to reopen elementary schools fully, how will the DOE ensure that students can maintain 6 feet social distancing in the classroom? Have schools erected outdoor classrooms? Are classrooms bigger now somehow? Or is the DOE above CDC recommendations in that we don't need to maintain 6 feet social distancing for long periods of time, but all other places must enforce this? Why would public schools be the exception? Also, do parents even have the option to request distance learning at the same quality of education, not through some automated software program, if they do not feel safe bringing their children back to a face-to-face classroom? What if they have family members that have not been vaccinated yet and they're afraid of spreading the virus within their family? How can the DOE go from leaving it up to principals to decide whether or not to bring students back, then make a blanket statement asking all elementary school students to come back fully for in-person learning? Has the DOE given more surveys and collected data about how students and parents feel about this constant open and close strategy in terms of learning? Some schools have open and close every single quarter throughout this entire year. How can you ensure that this isn't causing more disruption than needed when nothing has been stable throughout this entire time? I have students that are frustrated between this constant back and forth initiatives due to being pushed by the DOE, and this is affecting their learning and their love of school. Why is there a push to half-butt in-person learning when it was even admitted that there is still a lot of work to be done? First of all, what has been done during this entire year if there is still a lot to be done? If this were the intentions of the DOE all along, it should have been fully thought out since people's health and safety are being put at risk. Why not get the plan for next school year fully fleshed out than trying to haphazardly put
Deborah Bond Upson, followed by John Kaihue. Deborah Bond Upson, can you hear me?
Yes, I can. Thank you.
Please
Aloha.
proceed.
Aloha, Chairman Payne and board members. I'm testifying from Parents for Public Schools of Hawaii about establishing communications, trust, and confidence to reopen schools. Last spring, we were surprised when our survey showed widely disparate responses on how parents received communications from the Hawaii Department of Education, their children's schools, and teachers. Throughout the pandemic, we've heard from families, teachers, and now the latest principal survey that communication remains one of our key challenges in Hawaii public education. Our state has done well in containing COVID-19 infection compared to other states. Families, schools, teachers in Hawaii have borne this pandemic with grace and resolve, and we know we must focus now on how to remediate losses. According to CDC standards, Hawaii is at lower risk in the blue category. We are grateful that many of us have carefully followed public health advisories and the infection has been contained more effectively than in many other states. Missing their teachers, their friends, and usual social connections, students and families long to return to school. However, we do not just need to meet the CDC standard for lower infection rate. We need rigor and empathy to implement effective risk mitigation in order to reopen. CDC provides a mitigating risk walkthrough process to reopen each school. In this process, a video tour of each school with key staff attending follows a thorough checklist to evaluate readiness to reopen each school. The Hawaii DOE could support each school to complete the CDC mitigating risk walkthrough process. Each school could complete, submit, and share this video and summary report of each walkthrough. On successful completion, schools could reopen. This could establish communications at a more effective level and could enable the trust and confidence we all need now. We need this rigor, and we also need empathy. Even with a higher risk mitigation, we need to recognize that each teacher and family must guard their own health and welfare. Multi-generation families must be supported in protecting each household. All students and all teachers must have the right to continue distance learning if that is best for them. Mahalo.
John Kaihue. John, can you hear me? Chair Payne, John Kaihue is not present. That concludes oral testimony for this agenda item.
Thank you for that. We will now note that we have received written testimony on this agenda item, which is publicly posted on the board's website. With public testimony on this item being concluded, I would like to call on Superintendent Christina Kishimoto to provide the presentation on this agenda item. Go ahead, Superintendent.
Aloha Chair Payne, Vice Chair Uemura, board members and members of the public joining us today. Mahalo for the opportunity to share our strategies for safely ramping up our return to learn to our school campuses for in-person learning during the fourth quarter of this school year. Our presentation today is focused on to what extent we can use new guidance from CDC and DOH to increase in-person learning during quarter four. With me today is Deputy Superintendent Unabasami to help answer questions, and the entire Assistant Superintendent team as well. If there is a presentation, I'm hoping that can be put up so that the public can follow. Is that going to go up, or are we assuming?
That's not going to
I'm just
go up.
looking for guide. It's not,
Yeah,
okay,
it's
okay.
not,
Then
yeah.
I'll just make reference to the slide deck, slide number on the deck so that those who are looking at the public materials can follow along. The information we're going to provide today is how we're walking through and thinking about what's possible during the fourth quarter. As soon as we open up these conversations, I want to acknowledge there's going to be lots of sensitivities to any changes all along through this process. There's been nothing simple about going from a full normalized school year to the sudden closure. And it is much easier to close than it is to reopen. We know that every level of reopening has involved lots of work and lots of action on the school level with supports from all the support services staff and the complex and state office. And so as we open up these conversations, we are trying to keep the conversation and the communications focused on what we are exploring right now in terms of what is possible. And so you're going to hear me talk about that. I have not announced that we are opening up on March 22nd. That is not possible. We know it takes weeks to get another level of reopening done. And I also want to acknowledge that principals across the board have done a great job every quarter looking at the next level of reopening. And every time they've done that, they've had to revisit staffing capacity, facilities, resources available. They've had to revisit school schedules. They've had to reach out again to parents and make sure that parents haven't changed their perspective on what they previously had collected from them. And so there's a lot involved in this. And so I'm going to go through a slide that's just going to show how we've been thinking through this next level and what's possible, considering that there has been significant new research, science-based research, and new information as a result of that CDC and DOH has provided. If you look at slide 2, the top of it states reopening of schools. During the current school year, schools have been gradually returning students to campus for in-person instruction. Per the BOE instructions, schools have been implementing instructional models that best meet the needs of their most vulnerable students first, while adhering to the health and safety guidelines of state health leaders and addressing the concerns of employees. As we move into fourth quarter, the department plans to further ramp up for in-person learning, given the current low community transmission rate, the new COVID impact studies, and the CDC guidance operation strategy for K-12 schools through phased mitigation, which was updated on February of 2021. The CDC reports that there are consistent patterns that elementary schools have lower COVID incidence rates than secondary schools. Our goal is for elementary schools to transition into modified in-person learning, as we believe our elementary students in their developmental years benefit greatly from in-person instruction, and the DOH continues to speak to the health benefits of in-person instruction for our youngest learners. As reported for second quarter, 72% of our elementary school students received instruction on campus, 60% partially through blended learning, and 12% fully in person. We are also planning to transition more students into our middle and high schools to in-person instruction, focusing on our students who have struggled in accessing online learning and students enrolled in courses which require access to specialized equipment or materials or require strict supervision, such as our CTE courses. Many of our high schools started with either their senior class or their newest members of the school, ninth graders, who have not had a chance to acclimate to their new school environment. As reported for second quarter, 74% of our middle school students received instruction on campus. That's broken down as 69% partially through blended learning, so they're spending some of the time on campus, and 5% fully on campus. So the full on campus is still relatively small. 78% of our high school students received instruction on campus, and that's better understood as 76% partially through blended learning and 2% fully in person, which is why as we talk about going into the fourth quarter and looking at how in quarter four, just like in every other quarter, we can ramp up more students, we need to consider where we are and how we go to that next level. We need to mitigate the learning loss and address the educational disparities and inequities that were exacerbated by the pandemic and what already existed pre-pandemic. Returning our students to our campuses will allow to better provide the instruction, support, and services our students need to progress academically. We know that the students, when they're coming back, especially if you watch the students at the elementary and middle school level over the last few weeks, as schools have worked really hard to bring back another group of students, you can see the joy in them. You can see the amount of time that they have with the curriculum. It's very different from trying to learn from home. And we know that our families have worked really hard to support their children to understand this distance learning from home process, where our parents and family members have now become co-teachers with us to get the technology and the instruction in place. And we know this is still a less than ideal environment as we transition to a safer environment and a safer time when we can one day fully reopen. But as we do these transitions, we can see the difference in students in school as they're engaging, as they are very joyful, as teachers have more time with them, because that teacher to student time makes all the difference, and it's extremely important. For the CDC, they stay attending school where recommended mitigation strategies are implemented might not place students at a higher risk environment that then exists in the community. And having children in a monitored school setting may increase their compliance with health and safety guidelines on and off campus. The CDC also notes that in-person schooling for children has numerous health and societal benefits, especially for children and parents of lower socioeconomic status. So we continue to have these dialogues and seek clarity around how to balance between the need for students to come back in person, maximize that time with their teachers in this learning environment, at the same time that we're balancing between what are health and health needs and family needs in the home during these transitions. And so we continue to look at the guidance and examine very carefully every next level of decision that has to be made, or every next level of decision that can be made based on the new information. The CDC states that attending schools where recommended mitigation strategies are implemented. The CDC continues to provide information to us that it's not going to be an exact, but provides guidance overall, within which then DOH provides guidance to us. On slide 3, you see it's a reminder that we have a school reopening metrics that the board approved on October 15th of 2020. The data is updated regularly and it's publicly available on our website and also provided to the board. Included in this set of metrics is data on health and safety, in-person instruction, and student academic performance. According to our health and safety data, 86 schools have at least 60 days supply of PPE and cleaning supplies as of January 31st. Well, we would like, which is down from 93 schools that's reported on this slide. But we would like all schools to have at least a 60-day supply. There have been challenges, including nationwide shortages of gloves. We do have a supply of gloves to fill current school shortages and are awaiting a 3-month supply that is scheduled to be delivered to schools within 3 weeks. No school is completely out of any PPE item. As of Q2, nearly 12,000 students are receiving full in-person instruction. As of Q2, 21% of our elementary school students received a well below or not yet mark for language arts, and 15% received such marks for mathematics. So quarter grades for elementary schools indicate the progress students are making towards meeting the content standards. The expectation is that course marks will improve as we increase time the students have with teachers. And so this in-person time certainly is important. But again, as we're looking at these decisions, we're making them in balance with other situations and metrics that have to be carefully considered that I'll continue to speak about here. 26% of all students are receiving instruction only online by parent choice, which is just about 40,000 students are only receiving instruction online. On slide 4, as students return to our campuses, we have to ensure mitigation strategies are practiced, and practice mitigation strategies in school transfer to practices they can use in community as they continue to learn why these practices are important. We have stayed in frequent consultation with CDC and Hawaii DOH regarding department efforts around COVID, and have had a series of conversations about our plans and specific strategies going forward. Please note that throughout this school year, there has been a school health advisory committee run by DOH that includes public schools, charter schools, private schools, and Catholic schools, who all work together to provide feedback to DOH and DOH to us on to clarify guidance and to talk through situations and the impact of their guidance on our various systems. This has been a very positive and effective collaboration group led by state epidemiologist Sarah Kemble. Our most recent meeting with them as a group was yesterday, late afternoon, to discuss next steps that we're all considering based on new CDC research and guidance. A combination of effective mitigation strategies implemented with strict adherence can limit transmission in school setting. These strategies, as discussed by DOH and CDC, includes consistent and correct use of masks, physical distancing as known in the community as 6 feet to the greatest extent possible, understanding that this may not always be possible. However, it is clear that physical distancing can be maintained through a variety of strategies, such as cohorting, staggered scheduling, alternate scheduling, installing physical barriers and guides, and limiting non-essential visitors. It's important to note that physical distancing guidance has not changed in terms of language, but there's now new updated science that confirms the effectiveness of layered strategies. For example, the healthcare industry is not able to social distance necessarily at 6 feet, but the masking along with other layered strategies has prevented transmission of the disease in these work settings. CDC is talking about these layered strategies in a different way, and as well as other strategies such as hand washing or use of hand sanitizers and respiratory etiquette, such as no coughing or sneezing on others, cleaning and maintaining healthy facilities and ensuring adequate ventilation. Cohorting is not only a powerful physical distance strategy, but we have found it to facilitate contact tracing when necessary. And then ensuring students and employees stay home if they're not feeling well. That's absolutely critical. The Hawaii Department of Health has repeatedly stated that layered mitigation strategies are vital in preventing the spread of COVID-19. I understand there are concerns regarding the 6 feet distancing now that we've normed expectations around the standard. While this is recommended when possible, there will be instances where maintaining this distance will not be feasible. And so DOH has had discussions with all of the education entities about having the ability to have classes come back, but the absolute critical strategy of wearing masks, hand washing, cleaning facilities, equipment, staggered scheduling, and so forth. As we also watch what happens outside of the classroom, such as how students come in and leave the building, it's important to ensure that we continue with mandatory masking throughout our education systems. Both CDC and DOH have been consistent partners, providing feedback on our written procedures, assessing our lived protocols through school visits in a number of schools who have experienced multiple exposures to COVID, and or because of the facilities have unique challenges where their expertise would provide us clear instruction for health and safety reasons. They continue to visit schools on the neighbor islands in Oahu, and we're planning for visits on Maui in the coming weeks. They have confirmed that today there are no known case of COVID transmission due to school operations, even when a school experiences exposure to COVID confirmed cases. Speaking to department leaders, including principals in a joint meeting, they found that the public schools were the safest place for children to be in the public, and that's from the CDC visitor perspective. This is due to the dedicated efforts over the past 12 months of those who serve in schools, the custodians, cafeteria staff, front office staff, teachers, leaders, principals. They take their work very seriously and have been a cooperative learning group during this pandemic. It is because of them over the past months, the schools have been able to operate and receive students incrementally, assessing and refining their safety and response protocols while doing their best to stay connected and engage students in learning wherever they may be. On slide 5, per February 2021 CDC report on transmission of COVID in K-12 schools, COVID transmission in schools is associated with community transmission, and transmission spread can be limited with strict implementation of layered mitigation strategies. We have monitored for community spread of COVID-19 over the past 12 months and are committed to continue to do so as students return to campuses at various levels. When community COVID rates are high, there's an increased likelihood that the school setting in that community will experience exposure to COVID. Evidence shared by CDC suggests that when schools implement the layering of mitigation strategies with fidelity, transmission is limited. This is consistent with our experiences. At any level of community transition, all of the department schools have had options to provide in-person instruction, either full or hybrid, through strict adherence to mitigation strategies. Decisions regarding in-person instruction should be guided by information on school-specific factors such as mitigation strategies implemented, local needs, stakeholder input, the number of cases among students, teachers, and staff, and school experience with safe reopening. The leaders best situated to know this information are those who serve in that community. We look to their expertise about their learners, their facilities, and the resources available to make the best decisions on behalf of children and their families. The complex area leaders and principals, along with their teams, even though the pandemic has put them in novel situations, have consistently responded to keep their children and staff safe. Our past record is evidence of the thinking and commitment of those efforts through the multiple community transmission tiers we have experienced and the adjustments made to keep learning progressing. One of the challenges has been the constant new information, changes, and new learnings and demands due to the nature of this pandemic and our collective desire to best support students and community. It is through relentless dedication to those we serve that even in the worst periods of this pandemic, we served food to our learners as well as other school-age children from other education institutions. We passed out devices to connect the learners to their teachers, and we set up opportunities for learning first through packets, and then we moved to the virtual environment, and now have been moving back partially into some in-person and blended. The community transmission is low and continues to decrease. We believe we can provide a safe and productive learning environment that our families can send their children to, knowing that we will use this time to build their child's proficiency, as well as reconnect them to their peers and programs and services that engage and hold high interest. I'm going to talk about a couple of things related to how to do this safely and conditions that we're evaluating as we go, as we continue this important conversation. On slide 6, you see a summary on vaccination planning. Deputy Superintendent has been leading the vaccination efforts of the department, while A.S. Armstrong leads the health guidance efforts with DOH. Vaccinations are voluntary. Please know that there are many ways our employees have been able to get the vaccine, so we are not able to provide information on the number or percentage vaccinated. We can report, though, how many have asked the department to advocate for seats to get vaccinated. We continue to work closely with the Department of Health and vaccination and vaccine providers to provide access to the vaccine for our employees and service providers as frontline essential workers under Phase 1B of the state's vaccination plan. This includes all personnel who work daily with our learners and our public. The HIDOE has defined our frontline essential workers, essential education workers, to include teachers, custodians, bus drivers, front office workers, administrators, cafeteria staff, security personnel, substitute teachers, partner organizations that come onto our campuses. Therefore, we've prioritized school-based functions first, and the employees serving at the school complex area and state level who provide necessary services for the operations of schools. To help expedite the administration process, the department facilitated the collection and verification of employee information for individuals wanting access to the vaccine since January. Over 20,000 individuals have expressed interest in accessing the vaccine. All of those names have been transmitted to the DOH for scheduling. We have worked daily, sometimes multiple times daily, with DOH to provide our employees access to DOH-sponsored points of dispensing, or what you often heard referred to as pods. Our efforts are going to be limited by the volume of doses being shipped in, although those doses are increasing every week. Neighbor islands are moving a lot quicker. On Kauai, nearly all of our educators have received both doses. On the Big Island, nearly all of our educators have received a first shot, and most are getting their second. Maui County is also making good progress. Oahu has been a more complex endeavor, but that's to be expected given the population size. Thousands of our employees have been getting vaccinated at mass vaccination sites on Oahu in recent weeks, including at Leawood Community College. We want to express a deep appreciation to everyone that's part of standing up and executing on that pod, at LCC. Just this week, DOH informed us that employees were among those being prioritized for the state's early doses of the newly approved Johnson & Johnson vaccine starting Friday. The tremendous benefit is that Johnson & Johnson is only one dose rather than two. In our more rural areas, we've worked with DOH and health community care providers to stand up school-based pods to provide our school communities access. Recent examples include Waianae High School and Keao High School. Last week, 1,100 employees working at schools along the Waianae Coast received second doses through a partnership with Waianae Coast Comprehensive Center. Mahalo to them as well. On slide 7, going to talk about maintaining healthy operations. In addition to layering mitigation strategies and vaccinations, we need to continue safe operation practices. And so we will keep abreast of CDC, US DOE, Department of Health, and county health and safety guidelines. We'll continue to limit non-essential visitors on our campuses, allowing for the establishment of the school, continuing to mitigate physical distancing with the general public for the safety of our students and staff. We'll continue with our communication plan, utilizing our COVID response team to support our schools and offices should there be potential exposure to COVID-19. Mahalo to that team as well. They've been an action-oriented group throughout this pandemic. We'll provide training on safety protocols and provide for the provide continued training on safety protocols, and provide for the continuity of mental health services for students and employees, both virtually and in person. During our goal for Q4, I'm going to continue to advocate for the safe return of our students to our school campuses. In-person instruction will allow us to better meet the social, emotional, mental health, and academic needs of students. Their return will also allow the department to address lost instructional time and any learning loss. We will provide our students with access to a safe and inclusive learning environment and address resource inequities to provide students with the educational opportunities they need to succeed, including access to a well-rounded education, quality educators, and integrated student support services. The return of our students to schools demonstrates a responsiveness to the needs of our students as they return to work, and it also renews hope for our school communities that some semblance of normalcy is returning. We also hear frequent reports of older siblings taking on the responsibilities for younger siblings and sacrificing their own education for the sake of helping the family. These are results of, or these are outcomes of the COVID situation. Our vision for our elementary schools students return to campus is to return to students campus our vision right now is for all elementary school students to return to campus daily. This is our goal, used to then talk about and plan for what is actually possible. Reaching for this goal, we are working on a modified plan that maximizes the return to campus within the context of the need to account for staffing, parents who opted for distance learning through the end of the year, and ensuring a well-structured ramp up with clear supports in place. This prioritizes the learning and developmental needs of our young students, which are best addressed with in-person instruction. The priority continues to be the health and safety of our students and employees, and our schools are optimizing their resources to provide in-person instruction in a safe environment. We have identified a continuum of approaches that elementary principals and CASs are currently examining for the viability of each elementary school to maximize in-person learning, given limitations of facilities, operations, and the continued layering of mitigation strategies. Through the discussion with principals, they are examining the extent to which all students can safely return, including the adequacy of staff and school facility challenges. The number of students in a full distance learning that need continuous support to continue with that mode of instruction, what they have learned from their existing third quarter school implementation approach. Our elementary principals with support from CASs are doing a great job working through fourth quarter ramp up considerations. As I have stated, this is not a go live plan for the day after spring break. That is not realistic. Every shift in level of reopening takes tremendous planning, additional resource, and consideration for what's working and needs to continue to be in place, what's not working, and continued adjustments in those areas. I'm also asking that all middle, intermediate, and high schools continue to plan for the return of more students on campus. As students return to school, we will have to structure services such as student transportation and school food services to accommodate the needs for flexible scheduling to adhere to health and safety guidelines. In Kauai, as an example, Kazina shared that the school bus program is nimble enough to adjust if schools reopen on an aggressive schedule. That doesn't necessarily mean that all islands are in the same situation. And so this is where we need to see where each complex is ready for what level of additional school reopening. Layer mitigation strategies will be emphasized on our school campuses as well as our service providers. As DOH stated, layer mitigation strategies will provide the greatest level of protection for our students and employees. We will continue our joint planning meetings with DOH to review data and strategies to ensure we have the appropriate practices in place. After yesterday's meeting, revisions to DOH's guidance are in progress, and it's important to, and it will be important to decision making. On slide 9, we will continue to engage in conversations with our state complex area and school leaders to ensure effective processes are in place to facilitate the safe return of students to our campuses. Through our tri-level structure, we will engage with our employees to identify the support needed and will communicate our school plans with parents and families. But planning has to be fully completed. And so as we have these dialogues, there'll be different considerations that the public may hear about as the planning is happening. We will also continue collaborating with HGA, UPW, and HSTA as we plan to increase the number of students on our campuses to ensure a safe workplace for their members. I'm going to stop there and see and offer to the board that the entire assistant superintendent team is online along with deputy superintendent and I to answer questions or to have a discussion about where we are, and also as we explore what fourth quarter looks like and focus on the potential for having more elementary students on campus. Thank you.
Thank you, Superintendent. As board members, as you know, this is not an action item, so a motion is not required. So we can enter immediately into a discussion. And as the superintendent said, you can address your questions to any of the assistant superintendents or the deputy in addition to her. So just raise your hands when you'd like to speak, and I will call on you and you can unmute your microphone.
Board Chair, I also just want to make one more comment, and that is that as the board thinks about all the information I shared, if there are suggestions for things that you'd like us to consider, think about, and or additional information that the board would like to have, the team stands ready to do follow-up also even beyond this conversation. But your guidance around kind of your thinking based on what you've observed and what you've seen in the data, and you know, how our community is really pushing and pulling around what they, you know, how comfortable they are, what they need. Your thoughts around these matters are very helpful to hear also today. Thank you.
Thank you, Superintendent. Board members? Board Member Cox? Go ahead.
Thank you, Chair. Boy, that's a lot. I firmly believe that our kids need to be back in school, but to just say that automatically we're going to send them all back is not going to happen. I'm hearing superintendents say that schools will still be making decisions that are appropriate for their schools within their complex. One of the questions that I asked once before and I got no answer on is testing. If we can, are we going to do testing next fall? Are we going to do it then in the spring, you know, or how are we going to go about that? The other thing is, when you gave me data, and well, first of all, distance learning is never going to go away. So in the process of schools planning together, you got to have the principal and the teachers all have to talk about who's going to do what and how are they going to manage it. And what we don't want is to continue having a teacher do in-person teaching and then also planning on how they're doing their distance learning, because you need to really kind of separate who's going to do what. And then when you gave us the data that 31,000 students plus would be considered chronic absentee students, and 97,900 students are listed as vulnerable from January, then it's really clear that some of what's going on is not working as well as it should. So that's why I'm a firm believer that the kids need to be back in school. Do I think all elementary schools are going to have everyday person-to-person this whole fourth quarter? I don't think so. And it may not be appropriate. I do think there are some areas that it's going to happen. But the big thing I want to bring up is when we're telling our secondary schools to be prepared for next fall, I don't want to see the planning in the summertime, because obviously the planning didn't work last summer for opening up schools. So I want to see I want to see a process that the department is going to have to work with schools to make sure that there is a plan in place by the time school is out. Because when you try to do planning in the summer, half of the teachers aren't there. And when you're talking about master scheduling, for some of our smaller high schools, there's only one teacher that teaches a particular thing. For example, maybe one chemistry teacher or one calculus teacher or one art teacher. So parents need to have choices still if they're going to be doing distance learning, but they also need to understand that maybe the kid will have to come to school part of the time, even if they want distance learning, if they want to take art or they want to take something that there's only one teacher. So the amount of planning has to take place with all of the teachers. Same thing for fourth quarter with all of our elementaries. The teachers and the principals and the community need to have some kind of input. So I'm hearing, Superintendent, that you're going to be allowing for that, but that there is guidance that goes to the CASs, that goes to all of the schools, that they understand the goal that we're really working toward is face-to-face teaching every day, whether we make it or not. Am I correct?
So Board Member Cox, I think you summarized that very well. That is exactly what we're doing. We're saying that we know the data shows that in-person learning is what's needed for our students, but we also know we're in the middle of a health pandemic still, and that hasn't changed. But new information continues to guide our ability to bring more students on. So my goal to the elementary schools and the CASs is full reopening for elementary schools. Is that possible? By when? What would that take? Now they're planning around that, and which is why I keep saying we're saying during the fourth quarter, is that possible? Not the first day of fourth quarter starting, but during that fourth quarter, are we able to maximize or bring more students back with that goal in mind? And some school principals are very clear they can do it. And other school principals are saying they're really maxing how many students they brought back, but they have a very solid blended schedule where they are maximizing that students are back 2, 3, or 4 days in the week. And so that's what we want. We want their best thinking on maximizing and trying to aim for that goal, knowing that not every school is going to be doing the exact same thing, but every school is going to follow the same health and safety protocol, and every school is going to aim to maximize the amount of time that students are in front of and with and working with their teaching staff. And that really is the goal.
And so parents are going to be told, parents have to be very aware of what choices are and how things are going to be functioning, and that because often they'll compare, well, my school does this and the other school is doing that. So we need it very clear, communication-wise, that some of our schools are not going to be able to be fully face-to-face every day. That we hope that we get to that point, and we're really looking forward to that point for sure next fall. But again, our secondary schools have to be doing that planning already, and the department needs to be working with them to make sure, because operationally, it's not that easy with a master schedule. In fact, you're going to find out it's not that easy with the elementary schools. So secondary schools are even more difficult. The last thing is, at some point, I want to be told what the plan is for that testing that we have to do, that the federal government says we have to get done. And so far, I haven't gotten an answer on that, but that, because some of the testimony we had said, I don't want my kids sent back to school just so we can do the standardized test, because I'm not going to send my kid to school just for that. I want them to be learning. So I understand that the message needs to be done very well, that we have to test, but I don't know how we're going to be testing. And I know that if you have sophomores in high school that have been doing distance learning the whole time, and then you call them in all of a sudden and say, come in and take a test, I don't think you're going to have a whole lot of people showing up. So that's why I'm asking, what is the plan? Okay, I yield.
Would you like me to provide an
Go ahead,
answer?
Superintendent, you can
Okay.
respond.
Yeah, to Board Member Cox, you touched on a lot of items, and I'll go into any of them that you'd like me to. But they're all absolutely on point. It's the same list that we're following, right? It's the chronic absenteeism, vulnerable learners, the planning time it takes for reopening. So I'm going to talk to a few of these, but I'm going to understand that there's a lot of follow-up we need to do back with the board, but also as we continue to communicate with community, these are the same topics that we're hearing from them. The communications to parents, we talked about finalizing some conversations this week, having this discussion with the board and sending something out to parents or giving the schools language around how to explain to parents the planning that's happening around fourth quarter so that they understand that we're in planning mode right now and that we are not rushing to this next level of reopening. And so, having that kind of communication in sound bites doesn't work because that sound bite turns into 10 different or 20 or 100 different interpretations of what that sound bite was. And so we're putting in writing so that the principals have a letter that they can also add to and modify based on that school level. The planning at the school level continues to be really important, right? Because every school is not has the same facilities, not every school and area of the state has the same resources or access to staffing right now. And each school has to continue to ramp up based on where they are. And that's really important, which is why it's at the school level that I continue to provide the autonomy for principals to plan with their faculty. And they're doing a tremendous job of checking in, what are we ready for, doing surveys with parents. And then when we met earlier this week, principals were able to share with me a lot of the information they're getting from parents in their most recent surveys and how some of that information changed from last month's, check-in with parents, or 2 months ago check-in with parents, because that information changes, which is why, saying that statewide everyone's going to be in the exact same place at the same time during this pandemic doesn't make sense, because it will hold up the entire system from progressing faster. And so it's really about supporting schools where they are and having that collection of parent information and input at the school level where it makes most sense, because parents want to know what the impact is, not of all kids in the state, but they want to know about their own child that's impacting their lives. And so principals are doing a great job of collecting that information, and teachers and staff are doing a great job saying, what's that next thing we can do? And so we want to keep encouraging that as we go through this. And we also know some schools have much more challenges with chronic absenteeism than others. And there are different reasons for that. And we want schools to use their data to keep connecting with families to understand what's causing that. And what is it that families need to support them as they continue to go through this planning process. And you're absolutely right. This is really, really complex. There is nothing simple about saying there's a go and then it's go live, right? There's a go and then we've got to deconstruct that to all the components, including how food is going to be distributed, where it's going to be eaten, whether we still have the part-time staff that's a backbone to how we do our work, whether we have sufficient teachers in all the right grades and all the right areas at each point in time. So there's a lot of work involved with this. And then if the parent's perspective changes even slightly, principals have to do a lot of work to then adjust to make sure, again, that they can be responsive to their community. And then that student voice, especially at the upper grades, has been really important. Our principals are already planning for the fact that some of them feel by the fall, they can fully reopen. And others are saying, look, we're going to need to have a really, really high quality distance learning program so that we can continue to have this offering with blended learning because they have the demand in their community. And we don't know where we're going to truly be from the health perspective and the science in the fall, even if everyone received a vaccine. We still don't know what that really means because we're still learning a lot about this pandemic. I'm sorry, in the testing. Yes, so I sent a few weeks back a link to the board in one of my board briefs that has the outline of testing, how testing is going to happen. I'm going to make sure I resend that by tomorrow morning at the latest to make sure that everyone has that. And to make sure that that link in fact was put in there. So I'll double check that. But we are testing, we are required to test. The US DOE allows states to ask for an exception to testing if they have a replacement for it. You cannot, they are not giving waivers to any state from testing. So you do have to test. And so instead of trying to figure out a replacement testing, which takes a long time to plan, as you know, items and so forth, what we have done is work with our Smarter Balance Consortium, and the test is half the time, half the items. So we were able to get that test reduced down to the most bare minimum time to still get in the items that we're required to have to see where students are in those skills and competencies they have to meet. And so that's going to make a huge difference. That does not solve the challenge of required in-person testing. There are considerations for distance testing, but the laundry list of complex conditions that have to be met to do distance testing is going to be very difficult. If the board wants further information on that, I do have Rodney Luke on the line, and he can at any point give more information on that if the board would like that. We are allowing testing to continue to be expanded into the summer, and so schools are making those scheduled decisions.
Okay, thank you, Superintendent.
I
Board
yield.
Member Cox, did you, okay. Board Member Voss, followed by Board Member Fallon.
Thank you, Chair. It was heartbreaking to read the written testimony of parents talking about how distance learning is hurting not just their kids' learning, but also changing their personality. And with all this rhetoric, I don't want us to lose sight of the fact that keeping our kids out of school is causing real harm to some of our children. So I have a series of hopefully short questions. I'm not sure if this is for the deputy or the superintendent. My first one is, without naming any specific schools, what is the department's data regarding how much COVID-19 transmission, if any, there has been by or among elementary school students while on school campuses?
I am actually going to pass that on to Heidi Armstrong. I believe they may have the data in front of them. Oh, Board Member Voss, can I just clarify, are you asking about the number of incidents or the number of students or teachers?
No, I'm asking about
schools.
I'm asking about something very specific, not just reported cases where someone, a student or a child may have been detected on campus with the COVID-19. I'm talking about your investigation, your data showing what transmission, if any, occurred by or among students while on campus.
So I'm going to start off because I think I can answer that question, but then I do want to give it to A.S. Armstrong to add any more details. To date, we have asked frequently the Department of Health in Hawaii if they have seen or noted any transmission due to the operations of our schools. And to date, they have responded no. We have had multiple exposures for COVID confirmed cases, but we have not seen transmission due to the mitigation strategies. So I want to turn it over to A.S. Armstrong if she wants to add anything to that.
Hi, thank you, Deputy. This is Heidi Armstrong. I don't have anything to add. I was going to say the same thing, and I do want to note that the Department of Health has commended the Department of Education for their mitigation strategies. We have had cases with students, faculty members, classified, certificated staff in many schools, yet because of the diligence of the schools with their mitigating factors, we have not had that transmission of cases within a school. Thank you.
Thank you, Heidi and Phyllis, for that. My next question goes to private schools, because the experience at private schools here in Hawaii, particularly elementary schools that have been open for many months, is they've had the same, is that there's been no substantial evidence or actually any evidence of transmission within schools. Since the private schools have been successfully doing this for many months now, without any evidence of transmission in the classroom, what lessons or strategies is the department taking from that it will implement during the fourth quarter?
Oh, hi, this is Heidi Armstrong. I'll start this answer if that's okay. But I think it's that the schools have done their due diligence in planning and keeping classrooms in cohorts. They've been strictly enforcing the mask wearing. We've made a concerted effort for ventilation strategies, and then our health and our hygiene practices have really been emphasized. And I think it's the combination of all of those layered strategies that have worked to date. And we need to continue to be vigilant with those strategies, even as our case numbers drop. Thank you.
Thanks, Heidi. My last question is, I think for the superintendent, but anyone can answer it if they want. I understand that full reopening of elementary schools will not occur on March 22nd, and that, as Maggie said, there are a number of factors unique to each school that need to be taken into account. But I'm a little concerned about the use of the word goal, because to some parents, I'm sure that sounds like, well, maybe it'll happen or maybe it won't. So, Superintendent, is it the goal or is it the expectation that all elementary school students will return to campus daily at some point during the fourth quarter?
That's a great question. The expectation is that every school, every elementary school will present their model for how they're maximizing number of students back. And we've already heard from, and I have already heard from a number of elementary schools at CASAs who speak to being fully ready with the right staff and so forth to fully reopen. And then for those who cannot fully reopen, what is the adjustment they're making to maximize the time of elementary school students on campus? And I've had a number of shares from elementary principals around what that looks like, and they are very good plans, right? They're very much on target with, we can't do 100% for 5 days a week, full days. And their alternative plans look very strong, and that's what they're now doing, right? So the expectation is to aim for that goal, knowing that a number of schools will be able to fully reopen, and a number of schools will have to have an alternative to that full reopening, but really can look at some very strong models for getting close to that goal, or having an alternative that, again, has all of our elementary school students experiencing a good percentage of the week in person at their school campuses with their teachers.
Thank you. Thank you, Superintendent. I yield, Chair.
Board Member Fallon?
Thank you, Chair. I think this question would be for the superintendent. So part of the, I think the need as we move forward, as you move forward on your planning, is for us to know what progress has been made and who's responsible then for the progress. So I really appreciated being forwarded the school guidelines. I think it was February 26th when Department of Health, Sarah Kimball, forwarded the school guidelines to you. And part of it says that the complex area, in collaboration with the state, is responsible for determining and making decisions on the transition between in-person, blended, and learning from home models. Is that, because it's a guideline, is that what the department will be using in terms of clarifying who's responsible?
Thank you for the question. Yeah, that's Board Member Fallon. That's been the construct that we've used this year, this entire year, where the complex area superintendent is meeting with the complex area superintendents are part of the superintendent's leadership team. So it's all the assistant superintendents and the complex area superintendents meet several times each month since the school year has started. And goes through decision making together, and then the complex area superintendents go back and they lead their team of schools through those decisions, and then they sign off on plans for their schools based on this shared understanding of the guidance and shared actually construction of the guidance that we do. So that will continue to be true. DOH's letter essentially reflects the structure we have in place.
Okay, thank you for confirming that. In your presentation on page 5, this has to do with the safety issue and the fears around spread within the school and from the community into the school. So with this model, how and who, because there's so much responsibility then moving from the complex to each principal and each school faculty. And, you know, it is a lot. And there's a lot of anxiety for a variety of reasons. So in making the determination on what model will be used, there are different learning model parameters that the department has laid out, a Department of Health has laid out. Are you using the learning model parameters to make determination about in-person learning and so forth based on what the Department of Health has provided in their guidelines?
Aloha, Board Member Fallon. This is Deputy Felicity Basami. And the answer is yes. If you're referring to the thresholds, the colored coded maps that DOH puts out, and it talks about when it's appropriate for elementary or secondary schools and the types of models, we have been using that as a threshold for discussion, not necessarily like immediately turning towards those models, but it's a time when the school community can be talking about what adjustments they might make because of the community transmission.
Part of this has to do also with the question that the schools may get about why is my school not opening and why is the other school opening? So I'm trying to get really clear on kind of what specific measures that a principal has available and the school has available to make decisions. So thank you for confirming that. So some of the information shared in the planning effort today around mitigation and layering tends to be more general. I know one area in our board metrics that you identified had to do with ventilation and how many schools are still not ventilated properly. So I think part is, have we made progress in this area since we started tracking the information, number one? And then number two, going forward, how will principals know and how will we as a board know that progress has been made? And I'm just using ventilation as an example because it's already on the metric dashboard. I think another area around safety, which is not on the dashboard, is vaccinations and so forth. So is that something the state DOE will provide to schools, or how will that work? And then how will we be informed?
Board Member Fallon, I'm going to have Randy Tanaka answer the ventilation example that you gave, and then Deputy Unabasami can speak to metrics on vaccinations and why that would not be an exact metric right now, but she can speak through where the state is right now in keeping track of that, if that's okay. Randy, if you can jump on, AS Tanaka.
Aloha, Superintendent. The current work in ventilation comes in two forms. We have provided over 3,000 air purifiers for the most critical rooms that the principals have determined. Obviously, it's limited to some funding, but we got $2 million from the CARES money, and that has all been delivered since January. The second option, as represented by CDC, is to get as much ventilation through the rooms. So we've been promoting opening the doors. We're working on opening the windows to get that cross ventilation. Now, there are some schools that are closed environments, and we're working to figure out how that ventilation will work. We're very fortunate in Hawaii that the trade winds provide that cross ventilation. We're looking at how we can promote through fan systems to promote that ventilation across the rooms. So that's where we are with it. There are more heat abatement programs coming forward, but the funding and the priority is not in that direction right now.
So do we expect there to be significant progress made in the next few weeks? And then how will a principal decide if the ventilation is adequate or not? Because, there are general statements, and I'm just trying to help the conversation and the engagement so that there is the kind of information needed that can be used to explain a decision about why or why not.
And that there are two models that we use. One is, of course, from CDC, and one is from an organization called ASHRAE, which is the Association for Heating and Air Conditioning. And they have a model, a template actually, that we plug numbers in, and it gives us the turn of air in the room. So that's a tool that we use. We have provided when we passed out the air purifiers. So that's one method of measuring. As we march into the next school year, I can give you a better idea of how many we've completed, but the process is in place currently to evaluate and open up more rooms. Now, I need to caveat that in places like the Big Island, where we have the volcanic issue and the VOG issue, it's a little more complicated, but they have a greater amount of air purifiers in those schools. They had a larger distribution because of the VOG situation.
Thank you. Like I said, ventilation is one example, but I think the overriding issue for me is giving and providing information at the school level that they can use to plan and make decisions working with the complex. And so it's kind of like based on some data they have, because the layering and mitigation strategy are a bit more general. And I'm trying to get really specific and try to trying to move toward being more consistent so schools have the information and that the state assists each school or each complex, whatever, I think ideally, because this is a school-based strategy and you're asking principals to work with their staff to make the decisions, that the least we can do is try to get them some lowest denominator of information they can find. And it seems through the testimony and other sources that ventilation is a big one. So thank you. I guess who was going to respond on the vaccinations?
That would be me, Board Member Fallon. And I also want to add, I agree with that there needs to, there's the CDC and the DOH guidance around the mitigation strategies and how to layer it. What does that look like in a specific school? That we need to have some universal language and directions for the schools. We have been working not only with the CASs, but also with Department of Health in making sure that the instructions that we give to each of the schools, especially our elementary schools, is specific and approved by the Department of Health. And so right now that document is in their hands. We're hoping to get it by the end of business today so that we can have the CASs work with their principals and share it with them. So hopefully what you're wondering about right now is actually happening by the end of today. Going to the vaccinations, I just want to be very clear about the process. So as everyone knows that there are different priorities and frontline workers, essential workers, which has been designated for education is 1B. And every agency that has frontline essential workers must submit a list of all the employees that fall in that category, name, information, contact information, and so forth. Department of Education has been no different. For us, we put out a survey which asked our employees and contractors who work with our students. So bus drivers, while they belong to another organization, provide essential services to our students to get to school. So they were included as essential workers. So everyone that we designated as 1B got a survey that asked if they were willing to take the vaccination. We are not making it mandatory, nor should we, because there are various reasons why someone decides not to do it. And we then created a master list. That master list, as the superintendent spoke about before, it's up to 20,000, may have climbed even as we speak. We put the master list together and we have submitted that to DOH, and DOH is the leader of the vaccination program for the entire state. Whether this point of distributions are done by private providers and or by DOH themselves. And we have continued to update that master list of employees as we speak. The last call was made this Monday, and we submitted the last set of names to DOH. The DOH then turns around. Oh, let me just talk about the master list. The master list not only includes the names of the employees, but also their contact information and the zip codes of where they work and where they live, because sometimes the provider may be scheduling appointments on the weekends, and we believe that most employees would rather travel from their home to a nearby vaccination site if that's available to them. So they get all of that information. The providers, whether it's Peer 2, NBC, LCC, any of the providers on the neighbor islands, have that list to use to schedule invites for our employees. LCC is the only pod in which we, other than our school-based pods that you heard about, where we actually assist in getting our employees registered. And that has been at their request. We know that there's challenges that employees have been facing around getting a link from the pod and then finding out that all the seats have been taken or that they have gotten a schedule and then have been canceled. That has been due to the mainland weather and vaccines not arriving in time for the scheduled appointment. And so we have tried to keep people informed. We know that there's high anxiety right now around second dose vaccinations. And so for anyone that's listening out there, we have been working with DOH in the past couple of days about making sure that no one's window for second doses expires. That is very important to us that everyone gets vaccinated. So we have their names. We have been advocating for seats for them, and we believe we will have a solution for our folks by the end of today. We know that some people are getting appointments, and so just we know that it's starting to move. But that is the update on vaccinations. And if there are other questions that you have, Board Member Fallon, I'm more than happy to answer it.
I think that update and clarification is good. I just hope that we can track the progress on it. I understand it's voluntary, you know, and I respect that. But I do think it is a critical factor in safety issues and concerns raised by the community and within the school community. So I think that's a real important marker to stay on top of and track the progress on. The other area around responsibility and kind of progress, because I noticed in so this has to do with the layering and mitigation as it relates to strategy, is around social distancing. And I noticed that you're still working on that. Can you please clarify where the department is on social distancing and what it's working on? The chart you posted says you're working on it. You can't provide it at this time. Is that not updated? I went to the link because it's a huge issue.
Board Member Fallon, I think we're talking about the square footage of classrooms and the ability to physically distance students given the square footage.
What I was looking at is the link that you provided on page 3 of your reopening of schools to the BOE metrics and metric 2 social distancing. And what you say there is the department has had to delay the reporting of the social distancing gap metric and so forth. So I was wondering what's the challenge, what the delay is, and kind of what the plan is to update that. It's a critical one because I think schools will need that information for some guidance, and you know, I'm sure the community is wondering, and many parents.
Board Member Fallon, I'm gonna direct that question to Rodney, Luke, and Randy Tanaka.
By board Member Fallon, can you repeat that question for me?
On your Board of well, in your reopening plan, you reference the layering strategy, which is really a continuation of the strategy that I think has been used throughout the year, and reference the DOH guidelines. On page 3 of the presentation, there is a link to the dashboard metrics. And so last night I was looking at it and because one of the layering strategies around health and safety has to do with concerns around social distancing. I looked at metric 2 And it says you're working on it.
I'm
So,
good. I'm sorry, go ahead.
so I'm just wondering where are you in terms of reporting on that?
I'm sorry, I don't have that document in front of me, but I can tell you that our practice continues to be and has been those mitigation standards. The masking, the distance, to wash your hands. If you're sick, stay home. Identifying a problem and isolating that problem. Now with the addition of air circulation, air purification, and as you know, the process has been dynamic. Information coming from CDC is now less focused on distance, but more focused as the number one, the first line of defense is that mask. And that's the most critical part of the entire process. So we continue to stack those mitigation measures. But let me go back and actually
Right. Let me read,
look at
if I
it.
could, if I could, I'll read you what you have posted. The department has had to delay the reporting of the social distancing gap metric and is currently in the process of validating its information regarding social distancing. Your office will work with each school to validate its current school model with a centralized analysis done by your staff and will report the data as soon as information is available. So I am assuming that that information will be available to schools by school and that there will be some reporting done related to overall status and by school. I just want to be able to support the schools because there's a lot of responsibility being placed on them in school reopening.
And I agree with you. The little bit of the twinge on this is the recent comments out of CDC about distancing. We will go back and take what they're telling us and complete that portion of what the guidance will be at a school level. That's a little bit of where we're delayed.
So aloha, Board Member Fallon, if I can also jump in, this is Deputy Superintendent Munapasami. Originally, we were looking at a metrics that took a look at the square footage of the facilities and then using a formula for 6 feet distancing. What we found was that as we started working with principals and the CASs is that many of the classrooms and other types of spaces in the school were being repurposed, either for instruction or for some kind of other service. So for instance, in a school that I visited, several of the schools I visited, offices and or classrooms were turned into isolation spaces for health reasons, to meet the requirements of what to do when exposed to COVID. As a result, what we realized was that we needed to do some a much more personalized, customized assessment of what each school had in terms of being able to meet the social distancing requirements and what that metric, how to report a metric like that in such a way that all of our schools could universally be able to share that information on this particular dashboard.
And Board Chair Fallon, the other part of the challenge we have on that is we have a square footprint of what the space is, but there's a number of different things in the room that reduce that square foot. And for example, my wife was a second grade teacher. They had, cubby holes and different things in the room that reduced the square foot, which complicated the distancing formula. So that's why we need to go back on an individualized basis to look at that to make the recommendation. That's kind of the delay in the formula.
Thank you very much for the information and the update. I would appreciate, as you're moving forward with the plan, being updated, because I think on this one, the explanation is really important, and without getting too complicated, how you engage the schools and the parents, like you referenced on page 9, will be very important on this one. Thank you. I yield.
Thank you, Board Member Fallon. Student Rep Hunter Harris.
Thank you, Chair. I just want to make some comments. Thank you very much, Superintendent, for that very informative presentation about reopening schools. Speaking with students from all across the state, distance learning can only do so much. I mean, students are feeling disconnected, isolated, lonely, stressed, about where we're going or what we're doing. And with opening schools, I think that she definitely hit it on the head when saying that we need student voice when opening. And, this goes for all parties, making sure that everyone is comfortable with going back to school. That's our teachers, our parents, our faculty, our administration, and our students. I mean, we all need to work together to make sure that this is a safe and effective return to school that doesn't need to happen again. And I definitely appreciate that we're going in this path. Thank you. I yield the floor.
Thank you, Representative Harris. Are there others? Board Member Fallon, did you have something else? Okay, your hand went down. Anybody else have anything to say on this? While you're thinking, I have a question, Superintendent. Is someone collecting any data on parents who do not want to send their children back to school this year, or do not want to send them back until there's a vaccination for children? We did have some testimony from parents, and we've heard anecdotally from others that this is their plan. So this would make a difference if there's a significant number in the numbers of students who would be in the classroom. So is there any central data being collected on this?
Thank you, Board Chair, for the question. No, it's not centralized until it gets reported to us through the CASs. So it's the schools collecting the information from parents. And as we go through another shift, the expectation is, and principals are already hearing from parents or have surveys from parents and give them information of parents who are stating that they may not want to come back at all this year. And if we go from blended to in-person, want to, the limit in school, they're feeling, some of them may be feeling less comfortable with full 5 days a week, right? So they're listening to that input. And what percentage? Is it a small handful, or is it a significant handful or a significant percentage? And then they're also hearing from parents who are doing full distance, who may want to go the other way, right? With schools fully reopening, can they then opt the other way? So as they're collecting information, that's coming up through the CASs as we look at the model, at the models for being able to implement this next level of reopening, to determine where that is then presenting a need for additional or different supports for this next level. And that's true for every reopening. Is there are parents who then want to shift models. And school principals know where their parent information is on that, and are thus giving input to this next level of reopening based on that input. So for some of them, it's going to cancel out, right? They're going to have a few move and a few move the other way, and so they can handle that. But if they have huge shifts, then that has implications on how they're looking at this next level of reopening.
Thank you, Superintendent. Are there other board members who have questions? I see Board Member Voss, your hand is up. Go right ahead.
Thanks, Chair. One question I forgot to ask. And this is a question that relates to student mental health, and I really appreciate Hunter's comments. I get a fair number of questions, Superintendent, from parents about student athletics, which for some of our students is really a critical piece of their mental health. And parents ask me, for sports that are themselves inherently distanced, like say tennis or cross country, why can't those begin in some form in the fourth quarter? And so my question is, and I don't know who on your team can answer this, what is being done to enable and push that opportunity to improve or allow those students' mental health through athletics, particularly on islands like Kauai and the Big Island, where it is the numbers are very, very low?
Thank you, Board Member Voss, for that question. I think that's a critical question, and it does tie into Board Member Harris's comments as well about just the overall wellness of students and how they get connected, right? What I sent out to our principals a memo this week, I believe it went out it was dated yesterday, after working through with our school principals and our complex area superintendents, that we are allowing for all of the weight rooms, conditioning, use of fields for students to come back, work with their coaches, do practices and so forth, while the leagues are making a decision on whether they are going to start up any competitive sports. But short of competitive sports, we have lots of opportunities to engage students through within school games and within school competitions and within school workouts, conditioning, and time for coaches to work with their student athletes across grades, but also for students who are graduating this year and need to do things like videotaping their performance and conditioning work for that college application, college scholarship. And they should be able to fully do that. So the memo's gone out. I have worked with mayors who had lockdown access to county spaces that our schools are next to and rely on for their own shared spaces. And they have provided the permission for our schools to use that for athletic conditioning, to PE, to fire drills. And so now we have that access that's been opened up to our schools as well, that complements our internal reopening of these opportunities.
Thank you, Superintendent. I hope the department will encourage the schools to communicate directly with parents to make sure that they know that those opportunities are available. I yield, Chair.
Thank you, Board Member Voss. Are there any other board members who would like to comment? Board Member Cox?
The only thing I want to say about the athletics is competitive athletics. Remember that the students have to have a 2.0. And so somebody has to be checking. And if we have lots of students that are not passing, got to be on top of all of that. I'm just concerned that I'm happy for the well-being of all of our students. I just don't want us to say that athletics are more important than the academics, because they go hand in hand. And so I yield. That was only my comment to make.
Thank you, Board Member Cox. Board Member Harris.
Thank you, Chair. I mean, just speaking on students' well-being, I think Board Member Cox definitely was accurate in her statement. I mean, speaking as a student who does athletics at my school, I mean, I know that it definitely breeds great personality traits and, great life skills that you can have growing up. I think that this is a great step forward as far as us looking at reopening schools and really getting our students back to that social aspect where they can really fine tune their skills of interaction with other peers their age and other grown adults, how to act in a business setting. I mean, these are all very important traits that we learn as kids being in school, and I think that this is very encouraging, and we have to make sure that we all are in this together when moving forward. And another thing that we have kind of touched upon in our student achievement committee is chronic absenteeism, and I know we kind of touched it here, but also just students who are now being the providers for their families. I mean, that's another thing to consider when looking at our attendance and looking at our students. That's a huge factor that plays into how students are going to be able to go to school, or extracurricular activities, and just another thing to look into. Thank you. I yield the floor.
Thank you, Board Member Harris. Is there anyone else who would like to say something before we move on? I'm just checking. Board Member Nama'o. Go ahead, Board Member Nama'o.
Yes, thank you. Superintendent, thank you for your presentation. It was very thorough, but I have a couple of concerns, and maybe there's no questions in there perhaps, but I just want to bring up a few things that I am concerned about. It is grand of you to try to get our children back into the schools. And we all know that we would like to have children back into the schools. We support that. However, it has not been easy to make some of those things happen, and we have to do it safely. I'm concerned about having this thing rolled out without having perhaps principals have the opportunity to weigh in on some of these plans, because these are the people that are on the ground. And although you and your team want to see this happen, and we do all want to see this happen, the reality is the people that have to do the actual implementation of opening of the schools are the principals. They're the ones that have to create the situation for safety-wise. They have to think of everything. They have to think of their teachers, they have to think of their students, they have to think of the parents, and they're really on the ground trying to make all of this work. And I know it has not been easy for them, and I know in another week or two, it'll be 1 year that they have all been working really hard at this. And I expect that most of them are pretty exhausted. The same for the CASs, and then the same for your team. Everybody is extremely exhausted. So I know that trying to get the kids back into school, we've at least tried to do the hybrid learning, and I think that's working. I believe that students that are vulnerable or need additional attention, the principals and the schools have been making accommodations for these children. So that's helpful, and hopefully that will help these children. But I do have some concerns about, for example, for some schools to go, the expectation of schools to go fully distance learning on Maui, for example, could be very difficult. And I don't know if there are going to be some accommodations made for those schools on your part and your team, because, we have spiking numbers on Maui, more than even on Oahu. Our rates are terrible, for example. And I know that you mentioned that, vaccines are happening everywhere. Well, I can tell you firsthand, they're not really happening on Maui. In fact, for about 3 or 4 weeks, we weren't even giving out a vaccine at all to anybody. And I know this firsthand because I have my own staff of teachers who had all of their appointments canceled. And perhaps they're just starting now. So vaccinations are definitely behind. We have spiking numbers here on Maui. So I have some concerns about schools being able to open up properly. I know for some schools, they were only able to do their hybrid blended learning rolled out towards the end of February. And they're trying to do this now and get used to that. And then to expect that school, for example, to now do full distance learning in the fourth quarter when they're just starting to get through the routine and and process for these students as well as the teachers. I think it's a lot. It's a lot to be asking of these schools, a lot. I know they can try to get there. I know that there are some principals who are ready, set, go, that are ready and willing to make it happen, but they do still have concerns about the 6-foot distancing. You say, or the CDC says maybe that's not as important, but for some people that is very important. The 6-foot distancing is very, very important. And there's still some ambiguity and conditions about eating, having the ability to eat and take your mask off, and the distancing within cafeterias. Some of these students have to eat within the classrooms themselves, and so there are some concerns about that. They'll have to take their masks off in order to eat. I know for food service, for example, neighbor islands, it's difficult to create inventory and to expect to have full classrooms, or to have all the students to come back. It's not a simple task to create to purchase your foods and the plates and whatever other things that are needed. On Maui, it's a difficulty. It may be easier for those schools on Oahu, but for neighbor island schools, I think this is a problem. So please, I want you to, I'm hoping that you can keep in mind, one other thing I wanted to mention was the distance learning. For some families that still want to have the distance learning, it's not clear to the schools if they can continue on certain programs. Some schools have dedicated distance learning teachers per grade level. And if they go to a full classroom, then these teachers will have to abandon the distance learning and have to be in the classroom instead. So it's very complicated. It's not something that's very easy to do. And if parents want to still stay with distance learning, they may have a program, and perhaps you can address this. They may have a program that they can have distance learning continued, but they're not going to have it with a teacher any longer because that teacher has to be in the classroom, for example. So I just want people to know out there that it's not that easy to just say, let's open up the schools and have everybody run through the front door, because there's a lot of things that has to be done, and especially at the granular level of trying to get these things done, to make these things happen. And those people that are in charge of that are the principals. And I'm concerned if they've had the opportunity to weigh in, and if they'll have the opportunity in the future to weigh in, because they know their schools best. And I hope that you will really give these principals the guidance that is needed to help them overcome many of these obstacles, and to give them the autonomy really needed as well to do what's best for their schools, because they know their community, they know their teachers, they know their students. So that is my hope as we move forward in this process. I yield.
Thank you, Board Member Nama'u. Are there other board members that would like to make any comments or ask any questions? Give you a minute. If not, we'll be moving on. We don't need any action here, but I think it's very clear from the testimony, from the board members' comments, and from the discussion that we've had with the leadership, that this is a very complicated process. It's something that is needed. We do need to get our kids back in school. That's certainly very evident, but it's we have to be able to assure everyone that this is being done properly. And so I think there are a number of things that the board has said they would like to get more information on as we move forward. Some of those things we'd like to hear even before another board meeting as things can be pointed out to us as progress is happening. So thank you very much to all the leadership people who are here and the superintendent for sharing this information with us. And with that, we're going to move forward to the action items on our agenda. And we are at action item number 5. And this is the Human Resource Committee's recommendation concerning the appointment of the complex area superintendent for the Hana, Lahainaluna, Lanai, Molokai complex area. Are there any testifiers on this?
Board Chair, no oral testimony on this agenda item.
Thank you. Any written testimony on this has been publicly posted on our website. I'd like to invite Chairperson Takeno to get back into this conversation because we did not conclude it at the meeting, Human Resource Committee meeting prior to this. So we need to finish that conversation and then we need to vote. So Committee Chairperson Takeno.
Thank you, Board Chair Payne. So I guess we would roll it as normal where we would take the vote out of this committee and then move it to the full board. I'm trying to get clarification on that. Oh, no, okay. So we can just have this discussion and as a full board, we can, I guess, vote on this. So is there any questions from?
I think, excuse me, Board Chair Takeno, I think that, excuse me on this one, because what I think we need to do is we need to have a motion and then we can have a discussion and then we can have a vote. Since it's not coming as a recommendation from the committee, we need to kind of start over and let's have a motion and a second and then a discussion. So why don't you make the motion and then we'll have a second.
Sure. Hold on. I'm trying to find the I'll make the
would you like me to suggest it and then you can so move?
Yes.
Okay.
Thank you.
We need to have a motion to appoint Dr. Rebecca Winkie to the complex area superintendent position for Hana, Lahainaluna, Lanai, Molokai complex area. So may I have a motion to that effect? Dwight, you can say something. Okay, Dwight, Board Member Takeno.
Okay, I make a motion based off your statement.
Okay, it's been moved that we appoint Dr. Winkle to this position, and Winkie, excuse me. And I have second from Board Member Cox.
I'm happy to second this again.
Thank you very much. So we now will have a discussion, and Human Resource Chair Takeno, we kind of left the discussion hanging. So do you have any comments that you'd like to make? I think we did have Vice Chair Uemura had some things to say, and maybe another board member also.
Yes, thank you, Board Chair. And I appreciate Dr. Winkie continuing to stay on for this meeting. But I really just kind of wanted to hear from Dr. Winkie herself, because I guess what I was looking for is she could provide some examples that I guess was in the superintendent's memo about, I guess the areas upon which she was able to, provide or perform a positive difference for children and families, with her courage and effectiveness in advocating for equity for students and her colleagues. I guess I kind of wanted to see if she could share with us some examples of how she did that, as well as her track record in leading and collaborating with schools and the community. It was just glanced over in the, I guess the written memo, but I kind of wanted to hear from the candidate herself about, what she has accomplished in those areas, and if she could provide some examples for the board.
Thank you, board member. I wanted to give you some examples of where I have advocated for equity for the students. When I first joined the school that I'm at now, Princess Lahainaluna. Excuse me?
Go ahead, Dr. Winky.
Okay,
We hear you
okay.
loud and clear.
I'm sorry. I advocated for the students to have equity of access to standards-based instruction and grade level access, and to focus on what their abilities are and how we can close gaps and how we can give them the instruction that they need. And so I developed a process. We established a guiding coalition for the school to look at how we could do school-wide response to intervention. And that was quite a process of collaborating with the teachers, and stressing the importance of this for our school and how we need to be able to look at data to determine what our students need and to evaluate what kind of instruction is effective and to move them forward. And we did establish the Guiding Coalition, and last year was the first time we had established a school-wide RTI process. And we were able to see, some good gains in the data that we collected through our universal screeners. Unfortunately, at the end of the year, we weren't able to see what the standardized assessment said on that. But just getting the collaborative process going and having everyone buy into the process, and also that led into and tied into our school-wide improvement process as we went through the WASC accreditation. And I really believe when we were granted the 6 years accreditation, I believe a lot of that was because we had gotten so far into the RTI process that we could clearly articulate the needs of our students, and we had a game plan for moving forward and how we could improve scores at our school. Another most recent example on the equity of access, in my opinion, was leading our staff this year through this very emotional and trying time of trying to open schools during COVID. And we were able to bring our students back on for blended learning at the very beginning of second semester. Unfortunately, we were only in that for about a week before we had a spike in cases and had to go back to distance learning, but then we reopened again in February 16th. But that has, I would say this year has really tested my mettle as a leader in navigating the emotions. And I mean, you can see during the board meetings, you have people on both sides of the coin in the community, in the schools. But when I talk to the staff, I go back to what my guiding question is what's best for students. And I really feel like their access to being on campus is most important for their mental well-being as well as their academic instruction, especially in an elementary school. The foundational learning is just almost impossible for kindergarten and first grade. Although I'll have to say our teachers have done a tremendous, tremendous job. Collaborating with the community, I have worked with the Lahaina Educational Foundation and also known as the Lahaina Tutor Project. For the past 4 years, they have come in and worked with our students in math and language arts after school. But we've partnered on summer programs as well, such as a STEM program for the students. And recently, because of this pandemic, they have basically shut down their operations, but we're still partnering, and they're working with me when I have proposals for funding activities for our students. I've also worked with some of our Lahaina Rotary clubs who worked with us to get donated computers for our students. And even though we were able to get school computers for all of our students, they still wanted to help. And I said, if you want to donate these to our students directly, I will be glad to partner with you on that. And that took place at the beginning of the year. And we've this no longer gets on the equity, but we've also tried to attend to the basic needs of our families who are struggling economically and getting donations from the Maui Food Bank and restaurant gift cards, trying to support our local businesses. So just, I really have a very good and open relationship, I think, with our community members. And whenever I need their support to make something happen for the students, they're always there to help us.
Thank you, Dr. Winky. Do you have any follow-up, Board Member Nama'u or Board Member Takeno? Board Member Takeno, excuse me. You were the one.
No, thank you. Thank you, Dr. Winky. I'll defer to Board Member Nama'u.
Go ahead, Board Member Nama'u.
Aloha, Board Member Nama'u here. My question pertains to our discussion that we had to leave off on when Ken talked about the process for the CAS position. And I just wanted to circle back just a little bit because I just wanted to ask Phyllis, thank you. You were very, your discussion was very robust in how you shared, how you went through the process of the names, et cetera, going through that. And initially you had 16 candidates. And you said that you went through a video screening for those 16 candidates. So my question to you is, was that done in person? I mean, was there a live body in that video screening, or was that done differently?
Aloha, Board Member Nama'u. I'm going to turn it over to AS Covell, as OTM handled that portion for us. Thank you.
Thank you, Board Member Nama'u. Yes, it's called a Spark Hire interview. So the candidates apply, and then they're sent a opportunity to do an interview via video. And then the video comes back into the Office of Talent Management. And we had a small committee review those videos individually, and then came back and shared their scores and came up with the top 6 that got forwarded. So the video interviews, they're all given the same question, and they answer those questions and send the video back in, along with their resume and anything else they want to add to their package.
Okay, so this is something that's done electronically, and there's not a real person in that process?
Correct.
Okay, the reason I'm going down this is that I just think that CAS positions are extremely important. And at 16 people, and from my understanding, there's been less for people going for CAS positions. I would like to see the opportunities for all these people who are willing to take on a CAS position to be done in person from the get-go, and not rely on something like this kind of a video kind of a thing, because I think these are just missed opportunities for the department, a missed opportunity for people who are applying for these positions to showcase their their abilities to the department. So that is just my hope that in the future, for such important positions such as the CAS, and especially this one, because this is such a difficult district, being on 4 islands and all, I think it's really, really important to have the opportunity to meet with these people firsthand and give them the possibilities to share, you know, innovative ideas and complex, you know, situations that you can pose to them. So I believe that you have a very good candidate here in Dr. Winkie. This is no reflection on Dr. Winkie. Don't take this personally at all. I'm just saying that the process, I wish the process could be done a little bit better. And that's just my concern. I think in situations like this, I think you really need to be able to talk to these people firsthand, if at all possible, if you can. Mahalo, and I yield.
Thank you, Board Member Nama'u. Board Member Voss.
Thank you, Chair. Dr. Winkie, as Board Member Cox said this morning, thank you very much for being willing to take on this assignment and all the work and stress that it will involve. We appreciate that. My question goes to looking at the materials in this complex. Economically disadvantaged are 61%, nearly 10 percentage points higher than the rest of the state. And those are the types of students that would benefit most, I think, from getting back on campus, particularly at the elementary school level. And you heard the superintendent and her team talk about their process and thoughts. I want to hear from you, given that this, you know, as Kelly said, is a very diverse complex, has some very unique schools. What's going to be your approach, particularly for the elementary schools, to try to get as many students back on campus as possible?
Thank you, Board Member Voss. Well, as you mentioned, you know, we do have a diverse set of schools in the complex, and some of the schools, the population is small enough in comparison with the campus that they're able to get all of the students on and adhere to the social distancing and following all the mitigating measures. Personally, in my situation, I have approximately 700 students, and you know, without dropping the social distancing requirement, we wouldn't be able to get everyone on campus. We will be surveying the families again, because as you have mentioned earlier, there are some families that are not going to send their students back no matter what. And so looking at those numbers will be really important. But it's a little tricky going into Q4, because the students that have been doing distance learning and or blended learning, they have developed relationships with their current teacher. They have adjusted to the distance learning or the blended learning. So to make adjustments so that you had just one teacher doing distance learning on a grade level, that'd be a little difficult right now. But I do think that the conversations we're having about reopening schools for Q4 is important, because it forces the conversation. And one of the other board members mentioned earlier, I think it was Board Member Cox, is that we can't really effectively plan this during the summer. So, you know, putting the sense of urgency out there to do it as soon as possible in Q4, I think helps us plan so that even if we don't reach that goal, we're going to be ready for August. But I do think, you know, it is different with every school, and the principals probably know the community and their parents better than anyone. Biggest concerns to me is, even if you drop the social distancing measure, is making it safe for students to have lunch and to ride the bus to school. Those are not as easy to control, because it's harder to stay in your bubble. But I think just following the safety measures we have in place and continuing to have a collaborative conversation on what's safe, and having the parents input as we're going forward is the way to go.
Thank you, Dr. Wiki. I yield, Chair.
Thank you, Board Member Voss. Are there other board members that have questions for Dr. Winkie before we vote? Board Member Uemura.
Thank you, Chair Perry. I just have one question. I was looking, and just following up on Member Bruce Voss's questions on the attachment 3 that came with the materials. And I couldn't tell if the student scores that show in math, ELE, and science and all that actually increase or decrease. So can you, Dr. Winkie, address that?
Yes, Board Member Uemura. The scores on what area did you mention?
It's an attachment 3 of the materials that was given to the board. And it's a complex area comparison report. And it lists your current school.
Yes.
And on there, it shows math proficiency, ELA proficiency, science proficiency, math, and all that. And so I wasn't sure because it's color coded, but when I look at it, I couldn't tell if it was color increase or color decrease. So can you address that?
Well, okay. The copy I'm looking at right now is in black and white.
Okay, so you have the same problem that I do.
Yes, I'm having the same problem. But well, the scores are from the 18-19 school year, so I don't know that it's even showing a change. I do know the chronic absenteeism is from the past year, and so the chronic absenteeism went down, so the score increased in that regard.
Yeah, but I think it goes from the 2018-19 to 2019-20, so that's the 2 school years they're comparing it to.
Right.
So, but do you know offhand?
Yeah, well, I know offhand for our
scores?
schools, it had not yet shown improvement in the scores. That's where I was telling you when the WASC accreditation visited.
Yeah.
Our analysis of these scores and our plan going forward, they felt like was a solid plan and strong enough that they gave us the accreditation for 6 years. Our school is scheduled for a midterm visit next spring. And this past spring, we didn't have any test scores, so we don't really have anything to show there. And I will have to say, and I think we're not the only school that COVID has kind of set everyone back. But in talking with my school and our staff, it's like, yes, that has set us back, but that doesn't take the heat off. We still need to address where our students are and make strategies for moving forward. And the loss of instructional time this year is going to make it even more so important.
Yeah, so I don't want to, I'm not trying to put you in a spot. I'm just trying to, because you started at this school in 2017. So,
Yes.
there's a trend line from 2017 school year to the current school year. I know COVID had some issues on scores, but what is your feeling? Is the trending good for us at your school, that things are improving or things are staying the same or things are going down? I know you mentioned because of the accreditation, you didn't get a chance to finish, but what about from the beginning of your tenure there? What does the trend line look like?
I would say the initial trend line did not look, it did not show what I hoped, but as with any new adjustment, when a new principal comes in, you have to figure out the lay of the land and start making changes to move forward. And we were implementing those changes, but it doesn't happen overnight. The trend line was moving negatively when I got there. In the first year, we were using math curriculum from 3 or 4 different programs. We weren't working together as a staff. And so there were personnel changes after the first year. And since then, we've adopted a foundational reading program where we are showing gains on our universal screener and on our DIBELS testing, those students haven't reached third grade yet. So, you know, where a lot of the foundational scores, you know, that we were seeing growth, they haven't reached the statewide assessment grade levels yet.
Yeah, so I guess if I make this assumption, yeah, you're probably going to see a slight drop because of change in principle, but I think what you're telling me is that with the changes that you're making, that you're pretty comfortable that you're trending in the right direction. Is that correct?
Yes.
Okay, that's good to hear. So Chair Payne, you have the floor.
Thank you, Vice Chair Uemura. Are there any other board members who have questions for the candidate? If not, we will move to the vote. I don't see any other hands, so I'm going to do a roll call vote in support of the motion to appoint Dr. Rebecca Winkie to the complex area on Maui as noted. Board Vice Chair Kenneth Uemura.
Aye.
Board Member Asher. Board Member Asher. I think maybe there's a problem with the mic there. Board Member, I'll come back to you. Board Member Bakarse.
Aye.
Board Member Cox.
Aye.
Board Member Fallon.
Aye.
Board Member Nama'u.
Aye.
Board Member Takeno.
Aye.
Board Member Voss.
Aye.
And Board Member Asher. Okay, I see your mute is off, but we're not hearing you. But over the motion does pass, and I do appreciate, I want to echo the comments from Committee Chair Takeno. Thank you so much, Dr. Winkie, for participating with us through this long day, and best wishes to you as you move forward in your career on Maui.
Thank you very much.
Okay, so that motion is approved, and so we are now moving on to B, which is action on the Human Resource Committee recommendation concerning the declaration of the annual reduction in force for classified employees to initiate collective bargaining placement rights for employees displaced due to the changes in staffing needs. I will now ask board staff to call on any testifiers who have signed up to provide oral testimony on this item.
Susan Piccola Davis. Susan, can you hear me? Susan Piccola Davis. Susan, can you hear me?
Yes, can you hear me?
Yes, please proceed.
Okay, if the board will allow me just a little bit of flexibility here, I'd like you, hopefully you can hear it, the message that just came in on my phone.
One, new message. Aloha parents and guardians of Highland. Starting March 22nd, Highlands Intermediate will be moving to our blended learning model for fourth quarter. This means your student will have a designated day every week where they report to school for in-person instruction. Days out of school will be a combination of asynchronous work and virtual classes. A mailer has been sent home to you containing our fourth quarter parent guide.
Okay, I'll leave it at that.
Excuse me, but Ms. Davis, that is not the agenda item that we are discussing. So if you have testimony on the agenda item.
Okay, so I'm going to go back to my concerns about the part that we have from the agenda of this morning. And I don't want to beat a dead horse. I just guess I don't understand why it wasn't requested that we know the position and whether they were funded or no longer needed, because some of the positions are custodial, and I know we need custodians to clean the classrooms. And again, I will emphasize that the majority of education assistants were from special ed. So you know, I don't, without this list, I do not understand why the board approved this, but I will ask that if you do get the document from the DOE, if it can be made public or part of the minutes, or somehow have that done so that all of us can see what the positions were. And I'm sorry, but thank you.
Chair Payne, no further oral testimony for this agenda item.
Thank you. I would like to invite Human Resource Chair Takeno to present the committee's recommendation.
Thank you, Chair Payne. The Human Resources Committee recommends that the board allow the Department of Education to declare the annual reduction in force for classified employees for the upcoming 2021-2022 school year, I believe was.
Yes, thank you. And because that recommendation is coming from a committee, we do not need any discussion, any second before the discussion. So is there any discussion on this before we take the vote? Waiting just a few minutes. I see Board Member Cox. Go right ahead.
I said this all already in committee meeting, but I'm not happy, I'm not satisfied with just saying, well, most of them are EAs that are special ed and so forth. I think we should have had more information, and I think holding it off till the next meeting would not cause the department that much out of the way. So I again am voting no on this.
Thank you, Board Member Cox. Are there any other board members that would like to speak to this? Board Member Uemura, Vice Chair. Go ahead, Vice Chair Uemura.
I had myself on mute, so sorry about that. All the nay votes are speaking up, and I, along with Board Member Cox, voted nay, and mine was because for this very same reason. We don't have enough information. I'd like to have more information, and I'd ask that of the department. And I don't see a reason why we couldn't delay this. So again, I'm going to vote nay on this action. Thank you, Chair.
Thank you. Are there other board members that would like to speak to this motion and recommendation? Seeing none, we will move to the roll call vote, starting with Board Vice Chair Uemura.
Nay.
Board Member Shanti Asher.
Nay.
Board Member Bakarse.
Aye.
Board Member Cox.
Nay.
Board Member Fallon.
Aye.
Board Member Nama'u.
Aye.
Board Member Takeno.
Nay.
Board Member Voss.
Aye.
Okay, let me count. I might have to vote. 1, 2, 4. Okay, it's tied at 4-4, so I will vote aye, which means the motion carries. Okay. We are moving on to board action on the Human Resources Committee recommendation concerning compensation adjustments for Department of Education employees excluded from bargaining unit 13, and they are considered unit 35, which is the excluded managerial group. Is there anyone who would like to testify on this?
Chair Payne, no oral testimony on this agenda item.
Okay, so any written testimony is posted. And we'll now move on to the discussion. So I would like to invite Human Resource Committee Chair Takeno to present the committee's recommendation.
Thank you, Chair Payne. The HR committee recommends that the Board of Education approve the salary updates, compensation adjustments, and tentative agreements for excluded managerial compensation plan employees excluded from bargaining unit 13 and coded as bargaining unit 35, retroactive to July 1st, 2019.
Okay, is there any discussion on this? We do not need a second, so looking for any discussion on this, raise your hands. Seeing none, we'll move on to the roll call vote. Board Vice Chair Uemura.
Aye.
Board Member Asher.
Aye.
Board Member Bakarse.
Aye.
Board Member Cox.
Aye.
Board Member Fallon.
Aye.
Board Member Navajo.
Aye.
Board Member Takeno.
Aye.
And Board Member Voss.
Aye.
Okay, this passes unanimously and is approved. Okay, we are now at item D. Item D is board action on policy positions for the 2021 legislative session, charter school system structure, governance, and accountability. Do we have any testifiers on this?
Susan Piccola Davis, followed by Linda Elento. Susan Piccola Davis, can you hear me?
Yes, I can. I
Please
know
proceed.
that the board, thank you. I'm saying that the legislative process is a very important part of civic duty, which I played a role in this year. SB 76 SD2 requires the board to use desired qualifications for a candidate as having a working understanding of the state's tri-level system of educational administration with a minimum qualification of 10 years of employment in a Department of Education, with at least 5 of those years serving in the capacity as a principal or higher. My only comment is that those qualifications do sound reasonable, and as of today, the House received it from the Senate, and so it has crossed over to the House. Thank you.
Linda Elento. Linda Elento, can you hear me? Linda Elento.
Hello. Can
Linda?
you hear me now?
Yes,
Yes.
please proceed.
Good. This microphone thing's tricky. Okay. Good afternoon. I'm Linda Elenton. I'm a parent, and I've been a parent of a disabled child for 20 years now. I am testifying for the support of early learning. There are several bills that are education related, but I wanted to just point out a few things, or a bill that actually would be impacting early learning opportunities, not only through the Department of Education, but also in conjunction with Department of Health through the IDEA, which is the Individuals with Disabilities Education Act. A goal of a lot of parents, and which I would hope would be also the Department of Education, is for children with disabilities to have equal access to all programs of the Department of Education, and those that are held on campus or anything associated with that. Even a child with disability might qualify for special education under IDEA, or a parent might choose or might accept that the child's qualified but decide they don't need special ed. So what would happen is that child might or would qualify for maybe a 504 ADA accommodation. And so a disabled child may or may not have IDA needs, but it's also covered on another bill because it's under IDEA. And I wanted to reference SB 538. As I testified a couple weeks ago, I had suggested and asked that the education would provide some input. And the superintendent did provide a letter. And I had some questions actually. Since yesterday, I've been talking to staff at the superintendent's office as well as the civil rights compliance office, but I have not been able to speak to a person who could basically answer these three questions. Just looking at the date of the testimony is February 24, and it was written to the Judiciary Committee in the Senate. The third paragraph, it starts out with under IDEA. My question, and I did ask the staff to forward these questions, but I just wanted to mention them briefly. Maybe I'm hoping that you would also have the same concern. Under IDEA, and then the rest of the paragraph refers to the Office of Civil Rights in the United States Department of Education. I'm not sure what the reference is to under IDEA is meaning or what it's from. And at the end of that paragraph, it refers to complaints. I think it's very important that the purpose of the bill is for the Hawaii Civil Rights Commission. In Hawaii Revised Statute 368, there's a definition of disability discrimination, and the standards are different than what
Chair Payne, that concludes oral testimony on this agenda item.
Thank you. The committee, the legislative committee of the board took note of a number of legislative actions that were coming through, proposed legislation that we had not initially identified as what we would be commenting on. And we don't testify on any legislation unless we have already approved as a board what our policy statements are. So there were several things that emerged during the last month that I felt we should consider policy positions on. And those are reflected in the memo that I shared with you. One is that the board support proposed legislation that expands access to early learning opportunities for more children. We did a lot of testifying last session on that and didn't expect that so much would be advanced this time, but there is quite a bit of legislation speaking to the importance of that, and the board does want to, I feel, support that. There's other legislation on superintendent minimum qualifications, and one of the things, and we suggest that the board oppose proposed legislation that restricts its ability to hire and effectively manage and oversee the superintendent. There is mandatory orientation and training for board members, which applies to boards and commissions across the state, and specifically to the boards that are attached to the Department of Education, which is Teacher Standards Board and the Charter Commission. And so we have some concerns about that, and that is also reflected in there. There's recommendations on collective bargaining and employer votes, and we recommended a policy position that states the board supports proposed legislation that ensures the board is a critical party in labor negotiations with the exclusive representatives of bargaining units 5 and 6, although the board takes no position on other aspects of applicable employer group voting structure. So there's, I think it's important for us to understand our place and our role and how we support and oppose legislation, I think is going forward is really critical. So I would like to if you would like to discuss it. The motion is that we would amend the board's policy positions for the 2021 legislative session as proposed in Exhibit A of Legislative Ad Hoc Committee Chairperson Catherine Payne's memorandum dated March 4, 2021. So if I could have a motion and a second, and then we could have a vote. Board Member Fallon,
So moved.
Board Member Bacarse.
Second.
Okay, so is there any discussion on these positions that I'm recommending? Okay, seeing none, I guess we're ready for the vote.
Whoops, sorry.
Oh, I'm sorry, Board Member Fallon, go right ahead.
Thank you, Chair. I just had one comment, and I guess it's kind of a question, proposed edit. This is related to the early learning policy position
Yes.
statement. You know, I understand the complicated governance structures related to early learning. So there's sensitivity to language. But I think overall, I'd like to propose adding the board supports proposed legislation that expands access to quality early learning opportunities for more children. So just to add the word quality.
Okay, I have no problem with that. Would any other board members? That's kind of a technical change that we can certainly make in that policy, and that would be included in the motion that is on the floor. Any other comments? Anything else? Okay, with that change in the policy, we still have our motion on the floor that we will vote on, and I will call the roll. Beginning with Board Vice Chair Uemura.
Aye.
Board Member Asher.
Aye.
Board Member Bacarse.
Aye.
Board Member Cox.
Aye.
Board Member Fallon.
Aye.
Board Member Nama'u.
Aye.
Board Member Takeno.
Aye.
And Board Member Voss.
Aye.
Okay, so the motion passes, and we will include keeping an eye out for legislation in those areas. Our final action today is on the composition of the Committee on Weights, and this is Committee on Weights 12. I will now ask board staff to call on any testifiers who have signed up to provide testimony on this agenda item.
Susan Picola Davis. Susan, can you hear me?
Yes, thank goodness this is the last action item. I would
Please
like,
proceed.
I don't know if this, can you hear me?
Yes, proceed.
Okay, I don't know if this has been considered before as adding a Board of Education member onto the Committee of Weights. And if you would like to consider it, I would like to propose that Board Member Takeno or Board Member Uemura, because of their attention to detail on finances, if they would be willing to also play a role and be part of the Committee on Weights. Thank you.
Chair Payne, this concludes oral testimony for this agenda item.
Thank you. I'd like to call on Brian Hallett, Assistant Superintendent of the Office of Fiscal Services, to present the department's recommendation.
Board Chair, this is Superintendent Kishimoto. I was going to present, and Brian Hallett's available because of his historical knowledge on answering any questions.
All right, go right ahead, Superintendent.
Thank you. The department is seeking the board's approval for the composition of the Committee on Weights 12. Attachment B reflects 21 role groups that the department would propose to have at the table to help inform the committee on WAIT's 12 recommendations on the weighted student formula for school year 22-23 and beyond. Per the Hawaii revised statutes, the Committee on Weights must include principals, teachers, and other members of the appropriate professional skills, experiences, and qualifications to facilitate the work of the committee. The proposed role groups for the committee composition are intended to ensure equity of voice from across our school community, including representation from all types of schools, elementary, middle, high school, and combination schools, schools of varying levels of enrollment based on school size, schools from both rural and urban areas, schools across the state with at least 2 members from each county, varying job classifications, including regular ed and special ed teachers, principals, a registrar, and administrative staff like a CABM and SASA. Across the tri-level with a focus on voice from the school level in particular, but also from the complex area, a CAS and CABM. And community members with a preference for members who have served on a school community council and are familiar with the WSF and annual academic and financial planning process. The University of Hawaii's College of Education Dean Nathan Murata has been consulted and is in concurrence with the recommendation as required by statute. Based on the board-approved composition, the department will be seeking members from these role groups who can bring to bear for the benefit of the committee, not just their perspective and experiences, but also an ability to listen to their peers to develop the best possible recommendations for the entire school system. The committee's recommendation for the weighted student formula will be submitted to the board for consideration in the fall, typically August or September of this school year 2021. And this school year meaning calendar year. Mahalo.
Thank you, Superintendent. Are there board members who have any questions? I think in the past, this has gone through the FIC committee, but we didn't have a FIC committee meeting today, so it went straight to us. So Board Vice Chair Uemura.
Thank you, Chair Payne. I just wanted to just add some background information and maybe have a question for AS Brian, because he has a lot of history on this. But, 2 years ago at the FIC committee meeting, we had robust discussions on both the composition of the committee on weights as well as the report. I just want to make sure that we get the proper representation. And I think from the superintendent's report that, we're going in that direction. And not to say that the last time we didn't, but one of the concerns we had was, getting more representation in the neighbor islands and the rural schools. And so I noticed that the Committee on Weights increased from, I believe, 18 members to 21 members. And so there are more neighbor island representation. The question I have for Brian is that when we talk about neighbor island, are we just talking about, what neighbor are we talking about? Because one of the concerns we had the last time was that maybe we should have a representation from each neighbor island. So the Big Island, Kauai, and Maui. When we're talking about complex areas, when we're talking about school principals and things of that sort. So, and I know one of the responses to that was, well, some of these guys hold dual roles. And I really want to get away from that, because I would really want a principal as an example of a neighbor island school be just that. One which is a rural school be just that. So if you can respond to that, Brian. Also, there is only one category for rural and isolated school. I'm wondering there should be a bigger representation in that area, because that's where a lot of the comments came 2 years ago. So if we can begin the discussion on that, Brian, I appreciate it.
Sure, absolutely. Your recollection is correct that, that we have had members who have been on the committee who have fulfilled multiple roles. An example, we had Lanai High School or K-12 schools sit on the committee for a number of years. And that checked out several boxes. It checked the combination school and the rural school and Neighbor Island School. As Superintendent mentioned, we really strive to get a good cross-section of state representation. We want equity of voice across the system. I believe we have always had at least 2 members from each county, Kauai, Maui, Big Island, and Oahu, on the Committee on Weights. So I would expect that would be our minimal expectation going into this next committee to seek at least 2 members from each county.
Okay, so Ryan, I'm not sure if you answered my question, but my full question, but before I forget, I just wanted to also mention that the timing of the COWS report is, I think Superintendent mentioned September, and I believe it was September 19, 2 years ago. And when the committee had questions, there was sort of like a timing issue. So I was wondering if the report can come to the board earlier, like maybe in August, early August, so we have time to review the report and answer any question. I know there's a timing issue for you guys, but I'm just asking a question if that's feasible or not.
We would be targeting to have the report, the Committee on Weights work completed by August. We work backwards from needing to have an updated formula for the next to use for the planning period for the next fiscal year. So we're talking about this Committee on Weights will be informing the fiscal or school year 22-23. We typically release those financial plans to the field in late October, early November. So it is very helpful if we can get the work done by August and use September as a fallback if for whatever reason the board needs further consideration.
Okay.
We can take 2 meetings if necessary.
Yeah, so just to get your commitment, because the report was discussed in September, so we didn't have a lot of time. So if you can work backwards from the August, that'll really help the board to review your report and have any questions. But I would ask Brian if you can go back to the September minutes and take a look at some of the concerns that the board members have, and so see if you guys can address that when you do your work, and that'll be much appreciated. So with that, Chair, I'm going to yield because I see other board members have questions.
Yes, thank you, Vice Chair Uemura. We have Board Member Cox, followed by Board Member Fallon.
Thank you, Chair. Cox here. This is just to give you some history. Way back when I was on the elected board, the board had board members sit on the COW as a non-voting member so that they could keep the board updated if needed be. So that's just so you have some history. I yield.
Thank you, Board Member Cox. Board Member Fallon.
Thank you, Chair. This is just a question about kind of the differences in years in terms of impact to the actual school level allocation. To the best of your kind of recollection, have there been significant shifts in allocation to a school based on the weighted student formula? Significant meaning, large dollar amount, or have they pretty much been about the same based on the formula, other than budget cuts, those kinds of things?
Excuse me. This is Brian. Historically, for the first few years of the Committee on Weights, there were factors put into place, loss thresholds that limited the year-to-year change. For the past several cycles, there has been no such loss limit or variance limit. Variance is not so much due to, we haven't had big changes in the formula for several cycles now, but schools do experience enrollment shifts. And so that has caused, I would say, significant changes at various schools over the years.
Thank you. And so this ties into the timing of the report for decision-making. So this report, I'm assuming, is used for structuring the department's EDN 100 budget especially. Is that correct?
There's a couple charges. Yes, that is correct. And let me just briefly explain that the weighted student formula distributes, I believe, about 95% of the dollars in EDN 100. But in addition, one of the tasks that the committee takes on is to review all programs and all EDNs and give consideration to our funds better distributed through the weighted student formula or to maintain categorical funding. And that's essentially what we have today is after 11 reviews or passes at that, that's how our budget is structured, categorical versus what goes out through the weighted student formula.
So as it relates then to kind of the timing of budget preparation for the department in terms of BNF sending out their memos, how timely is the August deadline for those kinds of decision making and the timing to the board?
I hope I get at your question here, but it is always a challenge that we would use base budget appropriations for purposes of making allocations, or historically that has been. This has been an exceptional year, and this has been a great year to demonstrate that the complexity of needing predictable, reliable funding and the disruption it causes when we don't have that. But in a normal year, we would be using for purposes of planning for schools when they start their plans in late October, early November, the base budget. Even if the department were putting forth a request for additional funds, historically we have not factored requests for funds into schools' tentative planning allocation. We have waited until after the session to distribute any additional funds that might be sought. And I hope that answered your question.
It does in part. I just want to be sure that when the timing of the board's weighing in fulfills the board's responsibility and also supports the department given the reality of the executive branch's timeline for budget prep. So thank you.
Thank you, Board Member Fallon. Board Member Nama'u, and I have to say that I neglected to take the motion on this before the discussion. So we will need to do that before we vote, but rather than break the flow, I think I'll go ahead and let Board Member Nama'u give her comments or her questions.
Mahalo, Board Chair. Board Member Nama'u here. I just want to make a comment, or perhaps somebody could tell me how this works a little bit in terms of immersion education. How does immersion education get represented in this process? I don't know if there's an opportunity to add on as a role person in some capacity, because immersion education gets shunted a lot. And I think we have to start recognizing that this is something that needs there's some equity issues here, and that we should take care for immersion and for the students that are involved, the teachers, principals, et cetera, in immersion education. If there isn't an ability to add another committee, another member to this committee, I'm hoping that at least it's recognized in the roles or some of these people that you're already recommending, that we could have somebody that could offer a voice in regards to immersion education. I would really, really appreciate that. I yield.
Thank you, Board Member Nama'u. Assistant Superintendent Hallett, do you have any comments to share back at this time, or would you like to reserve comment later?
I would just say, that sounds fair, the suggestion for representation. It was a topic of conversation, and there was a recommendation in relation to Hawaiian language immersion coming out of the last committee on weights. That's all I would add at this.
Yeah, and this is Superintendent Kishimura. I will say that at the discussion level, we've had Kawi Sang and her team present to have the discussion of our programs and how they get supported across schools as part of the Committee on Weight discussions. We've also had representation that has programs at their schools or in their complexes. But we can certainly look at the members selected within these 21 categories and ensure that we have more direct representation of this program and this significant area of commitment that we have in this area.
Thank you, Superintendent and Assistant Superintendent Hallett. Board Member Voss.
Thank you, Chair. I had one quick follow-up question for Brian, which is sort of the other side of Ken's question on timing. Ken's right. 2 years ago on the cow, we had a very vigorous discussion, and the gist of it was that potentially, because of historical reasons, Neighbor Island and rural schools were being shorted on the weighting, and we wanted to make sure that the next time that was, got the kind of in-depth discussion that it needed and potentially be adjusted. And so, Brian, with everything that's going on, principals and CASs being exhausted, getting kids back to school, is it really realistic to get this thing done by August? I want to be sure that the Committee on Weights feels like it has the time to do the kind of analysis that we wanted them to do without feeling rushed.
Yeah, thank you very much for that question. I think we ideally, August is when we would want to target to have the product done. But recognizing the times we're in, that this work would need to occur over a summer which I expect a lot of time and energy focused on addressing lost learning by students. We're hoping, without having to call members to Oahu anymore, now that we've gotten fairly proficient at online meetings, although we haven't had Committee on Weights that had to do it. They're subject to sunshine, so the same challenges the board has in terms of taking testimony, and we'll be needing to work on those procedures. And hopefully that can help streamline and expedite the process. We do, of course, need with at least a week between meetings, given the sunshine law requirements. So I think what I'm saying is we would want to target August no matter what, and we would be striving for that.
Understood. I just want to make sure that while it's important to try to reach the target deadlines, because this is primarily an allocation tool as opposed to a base budgeting tool for the schools, that I want to be sure that the Committee on Weights gets it right, how it feels, as opposed to feeling rushed. I yield, Chair.
Thank you, Board Member Voss. Are there any other board members that have comments or questions? Give me a minute. Okay, seeing none, I need to go back and fix the mistake I made. So I need someone to move. Oh, I'm sorry, Vice Chair Uemura, go ahead.
I'm going to make the motion, Chair.
Oh, okay, thank you very much.
Okay. I like to make the motion, Chair, to move to accept the recommendation and Superintendent Kishimoto's memo on the composition of the Committee on Weights 12, but included in that Committee on Weights that you should have either as a separate category Hawaiian immersion member, or included as in one of the committee members, which I think the superintendent already said that she'll take a look at that. But I want to make sure that that particular position is included. So, and composition is decided by the board, so we can add 22 and say Hawaiian immersion in there. So that would be my motion on the composition of the board.
Okay, so we are
Committee.
to accept the proposed composition of the Committee on Weights with the addition of representation from Hawaiian Immersion. Is that correct?
That is correct.
All right, so do we have a second for that motion? Board Member Bakarse?
I second the motion.
Okay, so before we vote, are there any further comments that anyone would like to make? Because we did make a little change there. Seeing none, we are going to vote. On the motion that was previously stated, starting with Board Vice Chair Uemura.
Aye.
Board Member Asher,
Aye.
Board Member Bakarse,
Aye.
Board Member Cox,
Aye.
Board Member Fallon,
Aye.
Board Member Nama'u,
Aye.
and Board Member Takeno,
Aye.
and Board Member Voss.
Aye.
Okay, that motion has been approved. The last item on our agenda is late public testimony on board agenda items. So if there is anyone else, this is something that we have started recently. If you were not able to testify because of technical difficulties, or if you signed on late to testify, you have an opportunity to testify now. You have a 3-minute time limit, and I will ask board staff to let me know if we have anybody signed up.
Julie Reyes Oda,
Okay.
John Ka'ai-Hue, Deborah Anderson. Julie Reyes Oda will be testifying on the Human Resource Committee report. Committee action on recommendation concerning appointment of the complex area superintendent for the Hana, Lahainaluna, Lanai, Molokai complex area. Julie, can you hear me?
Hi, I'm here.
Please proceed.
My name is Julie Reyes Oda. I'm a math teacher at Nanakuli High and Intermediate School and a public school mom. I'm commenting on committee action on recommendation concerning new superintendent employment contract. I spoke at the Human Resources Committee earlier and asked for a recommendation to the full board for the superintendent contract not to be renewed. While I know that the vote was deferred for another time, I still want to provide my commentary. The board asserts in its legislative policy positions in its ability to hire, manage, and oversee the superintendent. So it is unfair to blame Superintendent Kishimoto for everything. I came to these board meetings month after month, hearing what I can only describe as bobbing and weaving maneuvers by the superintendent and the other department employees, while being questioned by some board members. It was annoying at times to hear non-answers being repeated, and I could hear the frustration of the board member who was asking. But it became clear the tactics worked. The question was dropped, nothing was accomplished, we moved on. What I'm saying is this: if we're going to judge the superintendent, the board has to look at what part they played in letting it get this far, and we can't be this conflict avoidant again. So would I be able to suggest an idea? The superintendent's contract will not be renewed. We will conduct a search for a local superintendent who will start on August 1st. We don't need some crazy contract like we're signing a pro football player. No one needs a car allowance. This person could possibly take a 1-year contract. They shouldn't be given more of a guarantee than any other at-will state employee. Superintendents don't earn tenure or permanency at all. In the future, one of the board's main goals should be to increase participation and transparency on the board. I know that House Bill 10 is dead this session, which was to add a teacher representative. The board should recommend to the next legislative session that there be several employer representatives, so we don't end up in a situation like this again. Finding a new superintendent will not absolve us of the mistakes that happened over the past few years. We have to be responsible for what we did too, and we need to be responsible for this educational system together. Thank you.
John Ka'ai-Hue, general business meeting agenda, item 4A, presentation on Department of Education strategies. John, can you hear me? John Ka'ai-Hue. John Kai Hue is not present. Deborah Anderson. Deborah Anderson. General business meeting agenda item 4A. Deborah, can you hear me?
Yes, can you hear me, Gail?
Yes, please proceed.
According to American Academy of Pediatrics data, more than 3 million cases of COVID have been recorded among children and 250 deaths at least. In Hawaii, as of March 1, we have had 12% of our COVID cases be age 0 to 17, over 3,150 cases. Of these, of course, only ages 16 and 17 so far might be able to receive the emergency use vaccine in the lowest priority order. Today, after 2 p.m., the State Department issued their weekly cluster report, and 6 cases of COVID in Hawaii have been confirmed to be the UK variant B117. This is 2 households on Oahu with no recent travel history. In one household, there were 2 adults whose symptoms began in January, and a few days later, 2 children tested positive for COVID without symptoms. They had attended preschool while potentially infected, and 38 close contacts were identified and underwent a quarantine. So we have not talked much about the MISC, the multi-inflammatory system. There was a 10-year-old in Michigan who was asymptomatic initially and basically has had to have both hands and legs amputated. We don't know what the long-term effects of COVID are, but I am concerned that we have not discussed that the DOH contact tracing program has basically not been functioning, and particularly we have a dearth of information about schools. I am so happy to be a part of the Prevent Hawaii Suicide Task Force. And in February 2016, Dr. Dan Galanis, who's a state epidemiologist in the injury prevention branch, says that there was a decrease in deaths by suicide in 2020, which is wonderful news, and reports that have been stated to the difference of that are not accurate. I was very pleased to hear someone talking about ventilation and also referencing some of the issues that we have with fog here on the Big Island. The overall point that I want to make tonight is, rather than pushing reopening, we have to promote safety first. Please remain ready to close schools as cases warrant, such as on Maui, where the hospitals are inundated and healthcare workers are overwhelmed. Mahalo for your time, and hopefully you know that the tsunami warning has been canceled. Have a good evening. Aloha.
Chair Payne, that concludes oral testimony at this time.
Thank you. Since there is no more public testimony or further business on the agenda, this meeting is adjourned as of 5:32 p.m.